please.
Genevieve DeKeel, the first name. Okay. Genevieve. Last name's DeKeel, Dekiel.
It helps my court report to get your diction, so that's why I do it. Okay?
Thank you. Good morning, Dr. DeKeel.
Morning.
Where are you currently employed?
I work for Columbus Inpatient Care. It's a hospitalist-based group out of Columbus, Ohio. We're contracted with 3 hospitals, including Mount Carmel, now Grove City East, and a rehab hospital in Westerville.
And what's your position there?
I'm a hospitalist. I round in the hospital, and that's my sole position.
And how did you come to be in that position, starting with your undergraduate?
Undergrad was at Florida State University. Florida State University.
Okay. Help us a little bit. Doctors tend to ask you the most.
Good morning, everyone.
Okay.
That's my fault, not Rennie's.
So bear with us a little bit. She's trying to record what's being said. Okay?
I forgot she's writing everything. So Florida State University, biology major, chemistry minor, and then I went to medical school at Ross University, and then I did my residency at Mount Carmel West Hospital for 3 years in internal medicine, and then I went straight to work as an internist, hospitalist is my title, at Mount Carmel.
And what are your duties and responsibilities as a hospitalist currently and since you've started at Mount Carmel?
Okay, so I work like a primary care doctor, what you would see your internist or your family med, but I'm internal medicine trained. So I work like an internist just in the hospital. My job would be admitting patients through the emergency department, taking care of patients that have already been admitted to the hospital floor, and discharging patients once they're ready to go home. And we provide 24/7 care, so my shifts vary between daytime, evening, or overnight.
Would you be what's called an attending physician?
Yes.
Can you explain what that means?
Attending physician just means that I graduated residency, just simple as that. I'm a full-fledged doctor,
Okay.
if you will.
And as part of your responsibilities of admitting patients and discharging patients, do you prepare death certificates?
I do.
Do you prepare discharge summaries?
I do.
Okay. What types of things do you do in order to prepare those documents?
I'll start with a discharge summary. Discharge summary is every patient needs one when they're leaving the hospital. So I'll go through my first step is last progress note. This is my practice. I take the top part called the impression from the discharge summary and essentially copy and paste that into my discharge summary and add on to it. So I'll go through the last few progress notes from the consultants that are on, any special or brief notes that have happened, and do a quick recap of the last few days or the full summary of what happened during the hospital, as well as the problem list, all the diagnoses that the patient's been diagnosed with during the hospital stay. The first one being the most immediate or why they were hospitalized, and a medication list at discharge, so that way the primary care doctor can pick up where I left off, and then anything that needs to be followed up on. So the primary care doctor it can be flagged for that person.
And what if the patient dies in the hospital? Do you still write a discharge summary?
Yes, every patient needs a discharge summary. It's one of the requirements.
And do you do anything different when preparing a discharge summary
No.
for someone who's deceased?
It may be a little bit faster just because the primary care doctor doesn't need to follow up on anything. So I'll still take that impression from the last progress note if the patient's been there for a while, and then just summarize saying what happened to lead to that person's demise.
Now let's talk about the death certificate. What do you do to prepare the death certificate?
Death certificate would be the time of death and the most immediate cause for what.
Certificate. What do you do to prepare the death certificate?
Death let's say, for example, severe let's say, for example, severe sepsis due to urinary tract infection as my most immediate cause. But whatever the patient was admitted for and then what happened during the hospital stay that led to that person's death. Does that make sense?
I believe so. So you start with what they're admitted for, you said?
Yes.
And then you look through the notes.
And it might evolve. So the person might come in with one thing and die of another, but it's whatever happened that led to that person's death. That would be the first thing on the death certificate.
And is it ever the case that you will fill out a discharge summary or death certificate without ever meeting the patient?
A handful of times, yes. It doesn't happen often.
What situation would that occur in?
Where I would have to fill out a death certificate for somebody I've never actually laid hands on. If somebody came in to the hospital and I was supposed to do an admission of that patient and the person died before I was able to even go and see the patient just based on my rounding and patient load. There's sometimes less than half of a handful of times that I haven't been able to actually lay hands on somebody that has died. I'm assuming you're getting into this example.
So, well, first of all, do you admit patients into the emergency room?
Yes. Patients that come onto the floor would either be through the emergency department or a direct admission from home or from a doctor's office if they're stable. If they're unstable, everybody goes through the emergency department. And then I would admit through the emergency department.
Okay. Your Honor, may I approach?
Okay.
Thank you. For the record, I'm showing
Is there something? Here.
all right, I am showing,
Hold on.
sorry. All right, I am, for the record, showing the witness States Exhibit 7B and 7C. Could you take a look at these for me, please? And just tell me what it is that I'm showing you. Starting with 7B.
7B. 7B is my discharge. Oh, actually, it's my discharge summary. It's my history and physical stapled together.
And for what patient?
Mrs. Jeremiah Hodge.
And what's the admission discharge date here?
The admission and discharge date are the same day. It's April 1st, 2018.
Okay. I'll take that from you. Sure. Can you please tell me what 7C is?
7C is a medication administration record of 2 medications.
And is this for the same patient?
It is.
And
Mrs.
during the
Jeremiah.
same time?
Yes.
Thank you. Do you recall treating this patient?
I don't.
Okay. After looking at the discharge summary and everything, can you recall what happened with this patient?
Yes. Sorry, I guess I have to backtrack. I vaguely remember the situation. And then reviewing the records, yes, I do.
Okay. Your Honor, do you care if I publish the history and physical? Okay.
It's not working well with me. I guess the first spot can go to the second. Okay. Looks like it's on the screens.
If it's easier, Your Honor, I can just have the witness read it to herself and then
No,
explain.
as I explained to the jury yesterday, they're coming in Friday to fix all the little problems here. We're gonna be dealing with this all day. I'd really take a couple minutes now.
Okay.
Do you have it turned on now?
It's on the TV screens on these. But I don't,
Work up there first, and then it
Yeah, and then-
stopped working there and started working on the street, so it's straight off.
Are you actually able to see the doc
on this, on the
on the
tables.
screen?
Yeah.
Because it's not on mine up here.
It's not.
Dun, dun, dun. This one's on me, guys. Since we're gonna be using it all day, we might as well solve the problem now.
More than normal.
And it's Paul. Good morning. It just doesn't seem like a morning without seeing you.
You know what they say about a day without sunshine.
Yeah. Okay, that's your new nickname, Sunshine. You picked it. You got it. Looks like it's got something going on up there. I brought the screen down from up here.
Good.
And we had like private show up on there a couple times.
That's a good thing.
Well, it's just not getting it as home yet, but. be better to wait till a break and then let you do your voodoo, or?
No idea what's.
Well, it tells me we're gonna go without it, and you might wanna bring the TV back. Of course, as soon as we go to break, it'll start working. When we work without it, he'll bring the TV in, we'll hook it up for the jury so that you can show directly off the pad.
All right.
Okay? Thank you, Paul. Sunshine.
Your Honor, may I reapproach the witness?
Yes.
Thank you. I'm going to go ahead and just show you the history physical. That way you can read it real quick to refresh your memory. Sure. Once you've done that, just go ahead and hand it back to me.
I don't know what that is, but it's concerning because it sounds like it's coming from behind that door.
Okay. Thank you. Does that help you to recall
It's
this
called
patient?
I have to be honest, it was
Hold on.
I'm sorry.
Can I suggest some 3M oil?
Sorry, folks.
It was taking a minute. That way you guys can see what they're talking about. And you were worried about getting your steps in today? I know. He retires in 13 days, ladies and gentlemen. So I'm surprised where he's as nice as he is now.
I'm surprised I can get up the house.
Are you able to see that, doctor?
Yeah. Am I allowed to move to the end? Yeah,
Yeah.
this is good. Okay.
Just whenever you get away from the mic, you just gotta be a little directional.
Yeah, you can't see it in the corner.
Sorry. You might be able to blow it up a little bit.
Does that help at all?
Sure.
Yeah.
Yeah.
Yeah, I can see it. Thank you.
Is that all right? All right. And is this the document I showed you just a moment ago?
Can you show the top part? Sorry. Yes.
And can you tell me just this top part here? Is this your entire discharge summary right there on the top?
This is, I will admit, this is a lazy version of a discharge summary, just basically because I've already said everything that needed to be said in the history and physical on my admission paperwork. So this is rather than reiterating the same thing and copying and pasting an entire portion, this is me just saying refer to the H&P.
Okay.
It's lazy.
Okay. And You say H&P, what do you mean by that?
Sorry. H&P is history and physical. Every patient that comes through the hospital, admitted to the hospital, needs a history and physical and a discharge summary.
All right. Is this the history and physical for that same patient,
Yes,
for that same admission date and discharge date?
yes.
And you read through this just a moment ago, correct? Could you give me a summary as to what happened with this patient?
Yes, she was I think she was 57, I apologize. 57, Miss Jeremiah Hodge. She came into the hospital in full cardiac arrest. She was walking out to the car with family, and she suddenly passed out and lost pulse. Someone, I don't know the details, but someone, a bystander of some sort, started doing chest compressions on her while 911 was called. When EMS arrived, she had no pulse. They took over care and they brought her to the hospital. She was still in cardiac arrest, meaning no pulse, when she arrived to the hospital, actively doing chest compressions. After a series of medications, continued chest compressions, she got a pulse back, and they did an EKG to see if anything was awry, and she had an ST elevation myocardial infarction. Big word, just means heart attack, but the type that needs to emergently go to a heart catheterization to see if there's any blockages in her heart. So a STEMI alert was called, an ST elevation MI alert was called. The cardiologist came to the hospital, brought her to the heart catheterization lab, and they did a heart catheterization. They sprayed dye in her heart to see if there's any lesions or blockages that would amount to what happened to her. And they didn't find any. They just found a whole bunch of old changes, but nothing that was lack of any blood flow that would cause a heart attack. She still had a pulse at this point. They brought her to the ICU, the intensive care unit. And in the intensive care unit, she lost her pulse again. A code blue was called, where pharmacy, nursing staff, all the ancillary staff that you need during a code blue to attend to a patient came. Still doing chest compressions. And I think eventually they got a pulse back, and she was on a ventilator with all full-blown life support. And Dr. Husel had a conversation with the family about her poor prognosis, and the family decided to withdraw care. And that's when she was taken off the ventilator and had passed. And all of this happened without me seeing the patient.
So you had zero contact with this
No,
patient?
this is me just summarizing what happened during her brief, very brief hospital stay. This all happened in a series of maybe less than 2 hours, I believe.
So you wrote this discharge summary, correct?
Yes.
And if you didn't see this patient, how did you know what to write in the discharge summary?
I reviewed the notes, and between the emergency department notes, the squad notes that are scanned into the computer, the heart catheterization notes, the note from the cardiologist, and then notes from the ICU, either a brief note from the nursing staff or Dr. Husel's notes. And my job is to summarize at that point because I hadn't seen the patient.
Did you review the entire medical record from this patient?
Define entire, I mean, no.
Page 1 to page...
No, I would have no time to do that.
And did you review the medication administration record for this patient as part of your discharge preparation?
No.
I'm sorry?
No,
Okay, and why not?
it's not part of my, I would have nothing to gain from reviewing a medication administration record, the MAR. I would have nothing to gain from that.
And why do you say you would have nothing to gain from that?
Because she had passed, and my job is to summarize her hospital stay up until that point, and it's not my normal practice to review the MAR when I go through and do a discharge summary, just because it's relatively low yield. I have nothing, there would be no addition to my discharge summary based on that.
All right, and did you prepare the death certificate for Ms. Hodge?
Yes.
Your Honor, may I approach the witness?
You may.
I'm going to hand the witness State's Exhibit 18G. Can you go ahead and tell me what this is, please?
It's the death certificate for Mrs. Jeremiah Hodge.
And did you prepare this?
I did.
And did you sign off on it?
I did.
Thank you. Not remaining public. I don't believe there's any objections from defense.
No, we stipulated too early.
All right. So I'm showing 18G. And is this the death certificate that I just showed you?
It is.
And what is the cause of death that you list here?
Multi-organ failure.
And can you tell me the difference between the multi-organ failure that you put here and then the two other things below that?
Yeah, so I have to put in this, once again, it's an educated guess as to what happened. So my first diagnosis on a death certificate is what likely led to her demise as reviewing the records. And then it's due to, if I can come up with reasons or rationale, or secondary to. So multi-organ failure would be exactly what it says. It would be multiple organs have shut down because of. And then in her case, it would be because of cardiopulmonary arrest. The prolonged arrest that she had, where she was without a pulse for, I would have to count out how long it took for her to get to the emergency department when she lost her pulse outside the hospital, including the ones that happened in the hospital, and then probably due to, and this is all a best guess based on her labs that I have.
And why couldn't you just put cardiopulmonary address?
Because
Or
it's always,
arrest, I'm sorry.
yeah, it's because it's due to something. So cardiopulmonary arrest doesn't just happen. I could put sudden cardiac death. I could have put that, but she had other things that I could go off of based off of her labs, I suppose.
Are there requirements of what you have to put in the death certificate?
Yes,
Can you tell me a little bit about that?
there's a whole published what you can and cannot write on death certificates. If something is due to something, you can't put it as your primary. I'm not really sure how I can explain that better.
So there are general restrictions on what you can and cannot put
Yes.
on a death certificate?
Yes.
What happens if you don't follow those?
It gets rejected and it comes back to me. So this is done online and it's very easy for me to do it. If you see it handwritten, the handwritten ones mean that somebody actually handwrote it and then submitted it to the funeral home, and then it goes to wherever it goes from there. But then it can be rejected and come back to me saying, no, it needs to say due to something. This makes it very easy since it's the electronic death registry system, and I can type out why the patient died and submit it right then and there, and then it automatically gets rejected and says, no, you need to write something different. So a lot of this is done for me. I mean, I have had some get rejected and I have to reinvent the wheel of why I think the patient died.
Okay. Thank you. Nothing further for this witness, Your Honor.
Mr. Lopez?
Do you want me to leave him up here?
Court, counsel. Morning, everyone. Morning. All right. Is it Dekiel?
Dekiel.
My last name gets butchered all the time. First thing I'm going to do is make sure I'm going to do it to you. Good morning, doctor.
Good morning.
Let's start off with the date in which you did these records for Ms. Hodge.
Okay.
That was in April of 2018, correct?
Yes.
And fair to say, in your role as a hospitalist at Mount Carmel, or with all these other hospitals, you see a large number of patients,
Yes.
especially between 2018 and now.
Yes.
Is it a fair assumption to say that absent having reviewed these records with the prosecution, you didn't have an independent memory of anything about Ms. Hodge?
Yes.
Okay. And then I believe after even reviewing the records, you said that you vaguely remember what had happened, right?
I remember yes, I remember the evening, and I remember code blue going off, and that's all I remember. Otherwise, I have lots of patients that I have to also see, and yes.
Let's get into medical records. you'd agree with me that medical records and things that are put in them are extremely important, right?
Yes.
Every progress note is important, right?
Yes.
Every consultation,
Yes.
every history and physical,
Yes.
every discharge summary.
Yes.
And they're important because they're relied upon by a number of people, right?
Yes.
The patients, if they are getting discharged and haven't passed away, they rely on that, right?
Yes.
Their primary care physicians rely on that, right?
Yes.
Other doctors rely on it.
Yes.
Now, in fact, they're so important that even on direct, you mentioned that death certificates have a whole thing. You mentioned a book of policies where they can reject things if they're not done appropriately, right?
Yes.
And that just shows just how important these records and the death certificates are to everyone involved in these patients' care, right?
Yes.
Now, I understand you testified that it's not your typical practice to review the medical administration record, the MAR, right?
Yes.
But if you chose to, nothing would have prevented you from doing so, right?
No.
In fact, every medication she received is in her electronic medical record, which is accessible to you, right?
Yes.
Nothing's hidden there, right?
Nothing's hidden, no.
So everything that Dr. Husel did with Jeremiah Hodge was completely transparent to every physician, employee, nurse, pharmacist, anyone that had access to the electronic medical record of Mount Carmel, correct?
Yes.
Nothing hidden whatsoever.
No, nothing would be hidden.
Now, I understand that in preparing your history and physical and the discharge summary that you reviewed, you gave a long list there. I was trying to write it. The ICU notes, code blue notes, all kinds of stuff, right?
Mm-hmm. I'm sorry, yes. I said, mm-hmm.
For Sam's sake, doesn't really translate on a transcript.
She caught herself. She's okay.
All right. Now, let's get into the history and physical, which I believe is State's Exhibit 7B. You have to forgive me. I have to walk back and forth to make sure this whole thing is on there. Okay. Did everyone see?
You have a question?
I just want to make sure everyone can see it.
Okay, well,
It's
that's
hard without the screen to know what's.
move on.
All right. Now let's go piece by piece of this. I know you gave a summary on direct examination, but I want to get a little bit more specific about some things you put in your history and physical.
Okay.
Now, first, you noted that she had a history of hypertension. That's high blood pressure, correct?
Correct.
Dyslipidemia, that's a cholesterol problem, right?
Correct.
CAD with stents, that means that she has a history of coronary artery disease, right?
Correct.
In fact, coronary artery disease is so severe that it required stenting to continue to remove blockage in her heart.
Previous stenting, yes.
Indicating that she had had a history
Yes.
of heart problems so severe it required medical intervention at prior dates. Correct?
Yes.
Now, that's the history she had prior to what happened where she had that first heart attack, correct?
Correct.
Now, when she arrived, she was found to be astolic. That meant she had no pulse, right?
Flatlined, yes.
Flatlined. And she was given 2 milligrams of epinephrine and remained without pulse with active chest compressions. Is that accurate?
Yes, I would have to review or go off of it because I don't remember the details, but yes, that's what I wrote, yes.
Okay. So epinephrine is a form of life support, correct?
Yes,
It's intended to bring your heart back.
yes,
And regardless of that first round of life support on the first heart attack, she still had no pulse and they were actively beating her chest as she was brought into the hospital.
correct.
Now, she's then given another milligram of epinephrine, 1 amp, is that correct?
Ampule,
Of bicarbonate and calcium gluconate. That's also life support, right?
yes,
So just to keep count, first heart attack, 2 doses of forms of life support, right?
what do you mean by 2 forms of life support?
The first time she received epinephrine, 2 milligrams, right?
Mm-hmm.
Still had no pulse.
Mm-hmm. I'm sorry, yes,
And then the second time she gets 1 milligram of epinephrine, she gets bicarbonate and calcium gluconate, right?
Yes,
So the first attempt to revive her with a form of life support didn't work, and a second round was initiated, correct?
yes.
Okay. So,
Just to clarify though, there would be 3 rounds of advanced life support at this point. It says every round will get 1 milligram of epinephrine.
Okay.
So if you count out the epinephrines, that would tell you how many so-called rounds of life support. If you're using life support, I'm using, life support would work. We'll use that term.
please feel free to correct me. So we're at first heart attack, 3 rounds of life support then, right?
Yes.
All right. She then regains her pulse, but is found to be hypotensive, right?
Yes.
And then the pressors are started. Pressors are vasopressors, correct?
Vasopressors, yes.
And that's intended to keep her blood pressure elevated enough for her to live.
Essentially, yes. It clamps down on blood vessels that you don't need to survive and shunts that blood to vital organs that you absolutely need to survive if your blood pressure is low.
Okay, so keeping count, we're still at first heart attack, 4 different rounds of life support at this point, right?
I don't want to say heart attack because a heart attack implies that there's a blockage of some sort, and I don't know if there's a blockage of some sort at this point. She has no pulse for some reason, but I don't want to say heart attack because I don't know if it's an actual heart attack.
Fair enough.
Okay.
Her heart is not working.
There you go. Okay.
She's had 4 rounds of life support at this point.
And a rest.
Okay. It's okay. One of the things is you both want to talk at the same time, and I gotta avoid that.
My husband says that too. And
Well,
arrest is what the term I would use.
Okay. First round of arrest,
There you go.
4th round of life support at this point, correct?
Correct.
She then lost her pulse again, and then is given another round of epinephrine. She's getting another round of epinephrine and aspirin, right?
Are you able to use a cursor to see where you are?
Yeah, let me just point you to it.
She has a pointer up there too, she can use that.
I know, I think she's asking me to point it out to her. Where we at?
I'm trying to follow him.
Okay. So,
Do you want to use this?
see where it says pressors were started?
Yes.
Okay.
Yes.
This is where we agreed that we're at
Yes.
the first arrest, 4th round of life support, right?
Yes.
Okay. She then loses her pulse again, correct?
Yes.
And then she gets another round of epinephrine.
Yes.
So we're at 5 rounds.
Yes.
Or 2 arrests.
Yes.
All right. She then regains her pulse, right?
Yes.
Let me do what you mentioned, the heart catheterization.
Yes.
She's then started on levofedrine. That's another form of life support, right?
It's probably the same vasopressor that was initiated in the emergency department. She was started on. That was probably a typo on my end. It should have said continued on levofedrine. This is an assumption on my end. The emergency department.
Yeah, I don't need to interrupt you.
Don't do an assumption.
Bingo.
Got it.
okay, whoa. Let's do a question, okay?
Does it say started or continued there?
It should say continued.
Okay. Regardless, we're at what? 1, 2, 3 arrests, and let's say, call it numerous rounds of life.
Numerous, yes.
There you go. Okay, she's at intubated for respiratory failure. That means that now not only is her heart failing, but her lungs are as well.
It kind of all goes together, yes. If somebody loses their pulse, the next step is putting them on a ventilator for life support. Yes.
Without your heart, your lungs can't work.
Yes.
Her body's failing,
Correct.
despite numerous attempts at life support.
Correct.
Resuscitation goes on from 1929, that's 729, right?
Yes.
Until 806.
Yes.
Roughly 37 minutes of after her heart stopping multiple times and numerous forms of life support, you're then resuscitating her for 37 minutes to get that pulse.
You have to remember that there was also an arrest outside the hospital where chest compressions were started outside the hospital, and I don't have the time that would be on the ambulance report for actually when it all started.
No, I'm speaking to this in our timeline where we are here.
Yes,
So not the CPR that went on for a while before she got there. I'm talking about now where she's getting resuscitation efforts
Yes.
at the hospital.
yes,
And this is after her heart having failed,
yes,
her lungs having failed,
yes,
and her having had multiple rounds of life support.
correct.
She's actively dying despite numerous rounds of life support.
Sustained.
Is she improving despite these efforts with life support?
No,
She's then brought back from the cath lab in PEA arrest. What does that mean?
pulseless electrical activity arrest. It just essentially means that she might have, she has no pulse. She has no pulse.
So despite
It's an arrest.
EMS, the ER department, cardiologists, all these people attempting to resuscitate her, her heart keeps on stopping.
Correct.
And this is also, again, despite all the different forms of life support she's being given, correct?
Correct.
And then you speak to initially a code blue was called. Now, I know you don't have an independent memory as to what you reviewed in this case,
Yeah.
but you indicated a code blue was called and that Dr. Husel was involved, right?
Yes.
May I approach the witness, John?
Amen.
Showing that the witness was labeled Joint Exhibit 7, page 133. Without saying what that is.
Okay.
You recognize that to be a code blue sheet.
It is.
And this is a code blue sheet referring to Jeremiah Hodge, correct?
Yes.
It's the same code blue sheet you referred to in your history and physical there, where you referenced Dr. Husel, right?
Yes. I don't remember specifically looking at this when.
Can we approach real quick here?
Yeah. Ladies and gentlemen, get to know each other. I figured by now you know a little
under your table?
Where did that go? All good, sir? Doctor, when you referenced the code blue and Dr. Husel in your history and physical, that would have required you to have gotten that information from somewhere, right?
Yes.
And that would be the code blue sheet, correct?
Sorry, I didn't mean to speak over you. I don't necessarily look at the code blue sheet. If something like this was to occur, normally there would be a summary, another physician who is running the code. There has to be a physician running a code. So normally there's a brief note or a progress note of somebody who ran the code. I don't usually look at the code blue sheets unless something was, didn't make sense in the note.
Understood. And at this time of night, when a code blue occurs, the ICU doctor for that shift is the one who runs the code blue, correct?
If that person, it's whoever can respond fast enough first. So usually if a code occurs in the ICU, it would be the ICU doctor.
And that ICU doctor on that shift was Dr. Husel, correct?
Correct.
So Dr. Husel was running the code that night regarding Jeremiah Hodge, correct?
I would have to look at the code blue sheet.
May I approach the witness, Your Honor?
You can approach, but lay your foundation first.
Would looking at the code blue sheet refresh your recollection as to who ran the code that night?
Yes, it's,
Your Honor, I don't think she has independent knowledge.
Okay, well, let's see if this refreshes the memory. That's the issue.
Your Honor, I don't think there's a memory that it can't be.
Okay, you're done.
May I approach?
You may.
oh my gosh, the signatures, geez.
Okay, just review it. Does that refresh your memory?
No, I didn't see it. I don't know. It looks like his signature, but I don't, it looks like a W and an H.
Stop.
Sorry.
Doesn't refresh his memory, okay? Go from there. Your doctor's memory.
Okay, so let's take it a step back. Dr. Husel was ICU doctor that night, correct?
Yes,
Code blue occurred with Jeremiah
Yes.
Hodge, right?
yes. It must be Dr. Husel that ran it.
Objection, speculation.
This is me using notes. Sorry.
Relax, let me do my job.
Sorry.
Okay? I'll permit it. Next question.
The code blue was successful, correct? Right, meaning the team that ran the code resuscitated her?
Can you put up the discharge summary or the history and physical again, just so I can look to see what I wrote? Yes, it was successful.
So Dr. Husel, and let me just take a step back. When the code blue occurs, it means that the patient is actively dying, correct?
Yes,
It's an emergency situation.
yes.
In fact, I believe you mentioned on direct examination that, actually, why don't you tell the jury all the people that are involved in a code blue situation?
Pharmacy for medication, providing medications, nursing staff, a phlebotomist to draw blood, a doctor, multiple doctors maybe if they're on shift. Several other ancillary staff, extra staff, if you will, to line up and do chest compressions. Each round is 2 minutes, so it gets very tiring. Multiple people need to tag in. That's usually the bulk of them.
And Dr. Husel was running that show, right?
Yes, in this instance.
Okay. And she was evacuated because of Dr. Husel that night, right?
Objection.
Again, sustained.
She was resuscitated after the code blue, correct?
Yes,
She didn't die.
she did. She did not die. No.
So Dr. Husel running the code blue resuscitated Jeremiah Hodge prior to the palliative extubation.
Yes.
And in fact, that was 23 minutes prior to the extubation, correct?
I would need to time it out. I'll take your word for it.
Now, this may seem like a fairly ridiculous question, but in your review of all these notes, everything you did review when preparing this history of the physical, did you see any notes or anything that gave you any indication that Ms. Hodge angered Dr. Husel?
No?
Did you see any notes that indicated that Dr. Husel, for some reason, after resuscitating her, decided that he wanted to kill her?
No?
Objection.
Sustained. Ladies and gentlemen, disregard the last question and answer.
Thank you, Your Honor.
Did anyone tell you that she cut him off in traffic or something?
Objection.
Sustained.
Now, I understand that you said when you were doing your discharge summary and the death certificate that you referred to it as an educated guess.
Yes.
Nothing to gain from having looked at the law, right?
Yes.
Now, and that's because when you're reviewing,
Okay, identify it for the record.
it's the same exhibit, Your Honor. Still showing the witness states exhibit 7B. Do you see that list 1 through 14?
Yes.
So you felt there was nothing to gain by looking at the MAR because you look at all these different things from all these different notes, correct? All the diagnoses.
I made those diagnoses based on vitals, her labs, and why she came into the hospital.
Okay, so you actually diagnosed these things. They were put in your discharge summary.
Some of them may have come from the emergency department physician and his documentation, but going off of any abnormals that I see on labs, that's what you're seeing for the diagnoses that you're seeing. It's a medical definition of any lab abnormality.
Interesting. I'm going to show you the first page of your discharge summary
Sure.
because it appears that the state's exhibit doesn't have the first page.
Okay.
I'll label this, Your Honor, as joint exhibit. Pardon me. Joint exhibit 7, page 6. This is where you actually put the active and final diagnosis, correct?
Yes.
Let me move that up a little bit. So this is where you actually put in your discharge summary the diagnosis that you made and others made as to what you believe was the cause of death of Ms. Hodge, right?
Yes.
Now, we're going to go back to how we talked about how important medical records are, okay?
Sure.
Now, I know you referred to it as an educated guess, and you felt that you didn't need to look at the MAR because there was nothing to gain from it, right?
Yes.
Okay, it's a compound question, start again.
This is transitional, Your Honor, just to get
I understand what it is. No.
She required life support, right?
Yes.
Despite that life support, her situation worsened, right?
Yes.
And that same situation is what caused her death, right?
Okay.
Objection.
Sustained.
You put as the final diagnosis all 14 of those things, right?
Yes.
It's some of the same things that you put on her death certificate, correct?
Yes.
And that's because you need to put, and I quote from what you said on direct examination, whatever happened that led to that person's death on those important documents, right?
Yes.
So in your training experience based off your diagnosis, those things,
Objection.
He hasn't gotten the question out.
would you have put something on the discharge summary or death certificate?
Objection, speculative.
Okay, hold on. You scrapped the first question, and I'll have to sustain on this. Do you want a sidebar?
No, Your Honor, I got 3 words to the question, so I don't know.
Well, one of
Wouldn't
those
put anything-
words was clearly objectionable, so.
You wouldn't put anything on a death certificate that you didn't believe was accurate as to a cause of death, right?
No.
Because it's important, right?
Yes.
Same thing with the discharge summary.
Yes.
And in fact, it's the most immediate cause of death you put on those documents, right?
Yes. For the death certificate.
For the death certificate. The document with all those rules, regulations, and potential rejection possibilities, right?
Yes.
Asked and answered.
One moment, Your Honor. Nothing further.
Redirect?
Yes, Your Honor. So we've established already you have not read, or you did not read the medication administration record, correct?
I did not.
Just a starting off point, Your Honor.
Okay, let's I'll let the question stand, but from now on, let's keep it proper terms.
When you wrote your discharge summary for Ms. Hodge, were you aware that she had been given 800?
Objection. We need a sidebar for that?
Yeah. Hi, guys. Tell me when you're ready. I know, I'll wait. You. So the objection is sustained. Ladies and gentlemen, you disregard the last question. Next question, please.
Thank you. Did any of the progress notes that you reviewed indicate any medications that had been administered by Dr. Husel?
I don't know. I would have to go back through and look at his notes.
So then, just to clarify, you did not review any of the medications that were administered by Dr. Husel to this patient?
No.
It was asked and answered, but let's move on.
Nothing further, Your Honor.
Okay, ma'am, you may step down. Thank you very kindly.
Thank you.
Call your next witness.
Thank you, Your Honor. The state's called Dr. Rohit Chand, please stand.
Not happy to be paralyzed, man.
Go right up around here.
Come on down to the little obstacle course here. Come on up. I need you to raise your right hand. Do you solemnly swear to tell the truth, the whole truth, and nothing but yourself to God?
That's all.
Okay, why don't you go ahead and have a seat? You can lower your mask if you wish. Okay. Okay, I need you to go ahead and have a seat, relax. And I need you to state your name. You got an aerial mic in front of you there, so state your name and spell it for me.
Sure.
That way my court reporter can hear your diction.
First name Rohit, R-O-H-I-T. Last name Chand, C-H-A-N-D.
Okay. You're a doctor?
Yes, I am.
Yeah, I've never known a doctor that couldn't knock that mic down. So let's get a little volume there because these people have to hear you and you're in kind of a fishbowl here. Okay?
No problem.
May proceed.
Thank you, Your Honor. Dr. Chand, where are you currently employed?
I'm employed with Columbus Inpatient Care.
All right, I'm going to ask you to speak up a little bit louder because I'm even having trouble hearing you. So could you repeat your answer to that,
I'm
please?
employed with Columbus Inpatient Care.
And what is your job title with them?
I'm a hospitalist.
And what type of education or training do you have to hold that position?
So after finishing medical school, I joined the internal medicine residency at Mount Carmel. After my training there, took my board exam for internal medicine, board certified, and then I joined Columbus Inpatient Care.
And where did you attend medical school, sir?
I went to medical school, Windsor University.
And when did you graduate from medical school?
I graduated in 2011, I believe.
All right, and from what we're hearing, there's a fellowship or residency first?
Correct, residency
And where did you do your residency at?
at Mount Carmel.
And what year were you licensed to practice medicine in the state of Ohio?
Well, when you start residency, you get your training license. So 2012 when I joined. And then when you graduate, you get your full license. So that was 2015.
And are there any continuing education requirements for you to maintain your licensure?
There are.
And has that licensure remained in effect since 2015?
It has.
Now, what did you practice your residency in?
Internal medicine.
And are you board certified at all?
I am.
And what are you board certified in?
Internal medicine.
And when were you board certified?
2015.
And has that been maintained since then?
It has.
Now, you use the term hospitalist. Can you explain to us what that is?
Hospitalist essentially.
You've heard the definition of hospitalist about 18 times.
Oh,
Go ahead, sir, you can answer.
Essentially, as my colleagues have said, we're the primary care providers in the hospital. Essentially, we admit patients, take care of them on the floors, and then eventually discharge them.
Okay, so other than admitting patients, what else is part of your job duties as a hospitalist with Mount Carmel?
So essentially, when you're the rounding physician, our job is to round on essentially see all the patients that are admitted to the hospital and tend to their day-to-day needs.
Now, I note that Mount Carmel's hospital records has an attending physician listed for each patient. Tell us what that means.
Essentially, that would mean we're the go-to person for anybody who needs any assistance or information, or we are essentially like the quarterback. We're if we need anybody on board, we get consultants on board, but we are the primary care providers, essentially.
And in 2018, were you performing the same type of duties as a hospitalist at then Mount Carmel West?
I was.
From January 11th of 2018 to January 14th of 2018, did you treat a patient by the name of Brandy McDonald?
I did.
And Your Honor, if I may approach the witness, I believe we've got this figured out to make life easy for everybody.
Okay.
Sir, I'm handing you a mark for identification at bottom of your State's Exhibit 5C. Could you identify that for us?
This is a discharge summary.
And who's that for?
It's for Miss Brandy McDonald.
All right. And sir, I'm going to leave that up there with you, so if you need to refer to it, you're able to. And what I'm going to do is put on the big screen here for the jury. All right, and can you see what's on the big screen real quick, sir, at all? No. Let me see. This is difficult, isn't it? Can you see the number 5C at the bottom there, sir?
I can.
All right, and then at the top, what patient is that for? A little bit further down.
Brandy McDonald.
So is this what you have in front of you there, sir?
I do.
Okay. And what were the dates she was admitted into the hospital, sir?
Looks like she was admitted January 11th, 2018 and discharged January 14th.
And during that time period that she was in the hospital, did you in fact see her?
I did.
Do you remember her?
I don't.
Okay. Feel free to look at the discharge summary and see if that refreshes your memory, sir.
Vaguely, but I can see what I've documented here.
All right. What was Ms. McDonald in the hospital for at that time period, sir?
Looks like my partner admitted her after she was sent by her outpatient oncologist for essentially abnormal liver function tests.
Okay. And obviously, from this, does she have several diagnoses that you provided to her in the discharge summary?
Towards the end of the stay, once as her care progressed.
Okay. Before we get into her details, can you explain to us what you look at and how you arrive at your discharge summaries when you're discharging a patient from the hospital?
Progress notes, consultant notes, any pertinent imaging that was done, labs. That's pretty much it.
Okay, so in then creating the discharge summary, how do you go about doing that?
Same way, just review all those things that I mentioned.
Okay. Where would you derive the active or final diagnoses from in the hospital records?
From our progress notes, from ongoing progress notes from the day before.
Okay. And then turning to page 2 of that summary, Exhibit 5C, there's a part that is labeled, and let me double check this, hospital course. Can you explain to us what that is?
Essentially, it's a brief summarization of what occurred when she was in the hospital.
And can you give us a summary of what occurred with Ms. McDonald?
So according to this, she's, unfortunately young, who had metastatic ovarian cancer. She had multiple surgeries.
Okay, so I'm going to ask you to speak up a little bit and slow down a little bit.
Okay, so she's a 37-year-old female who came in with abnormal liver function test. She had a diagnosis of metastatic ovarian cancer.
I'm going to stop you here. What does that mean to us?
Cancer of the ovaries had spread to all her or some of her organs.
Okay, go ahead.
Looks like she was on a clinical trial study for a chemotherapy agent because the traditional treatments did not work for her.
Okay.
So she was on trial with some medications that the oncologists were treating her as an outpatient. It appears that that's the direct reason why she was admitted, because the presumption was that the chemotherapy side effect essentially caused her liver function deteriorate.
Okay.
So she was admitted to the hospital for that. I consulted as my part of my job to get the specialists on board. So it looks like we consulted the oncologist. I believe gastroenterology was also consulted because the liver has to do with the GI system.
Okay.
She was started on some steroids to see if this would start healing her liver, and it appears that she continued to deteriorate. With that, she developed kidney failure. Then the kidney doctors were consulted, and eventually her lungs started to not function properly, so she was transferred to the intensive care unit.
Okay.
And it looks like she got intubated, so which means they had to place a breathing tube emergently to stabilize her. And there were talks about starting dialysis on her for her kidneys, just to do anything that we can to help her, but it looks like she did not tolerate dialysis. She actually started to require vasopressors, life support medication on top of the ventilator. And then, the code status discussions were held, and eventually looks like her liver just went into fulminant failure.
Okay.
And then I guess she was palliatively extubated. So once it was discussed with the family, and then she passed.
So she had both liver issues as well as severe kidney issues at this point?
That's correct.
And I'm just going to move this up a little bit. Actually, I'm going to switch to the last page of the discharge summary and double check and make sure you can see it. What led to Ms. McDonald's discharge from the hospital? On the last page of the discharge summary, do you have that, sir?
Can you repeat the question?
What led to her discharge from the hospital, Ms.
Her
McDonald?
demise.
And that would have been in a court after her palliative extubation?
Yes.
Now, in looking at the records for your discharge summary, did you look at what medication was administered to Ms. McDonald during the palliative extubation?
I did not.
Would that be something that you would typically do?
I do not.
Why?
For a consented palliative extubation, there's no reason to believe anything of the sort. So we have a reason for why they're already there deteriorating, and that's the end of that.
So you would have no idea what medication was administered to her at the time they withdrew the vent?
I did not.
Now, sir, during your treatment, did you treat her during the time she was at the hospital? Do you recall?
Just reviewing the records.
Okay. So nothing else specific to that?
Nothing.
Now, for Ms. McDonald, did you complete a death certificate?
I did.
And I'm going to put up here what's been marked for identification. Let me see if I can see that up there. Can you see the number there?
Yes.
And what number is that, sir?
18E.
Okay. And this is a death certificate for which patient? I believe you have a copy at the back of your,
Yes, Brandy Lynn McDonald.
okay. Now, tell us a little bit about when you are asked to fill out a death certificate. How do you do that, sir?
So death certificates come to us sometimes days after, so sometimes I could be off shift, I could be at home, and it looks like on this death certificate, this was a cremation.
Okay.
So when a cremation occurs, the funeral home is really pressed on time because they need this to proceed.
Okay.
Without this, they cannot proceed with the cremation. So you essentially briefly review the record of, and then come up with the diagnosis that you felt led to the demise.
All right, we've heard a little bit of talk about this. What I see with Ms. McDonald is you have 2 lines filled out for the reason for death. Can you explain what this section means to us and how you would pick what goes in this section?
So the first line is immediate cause. So, I felt her immediate cause was, the reason she was admitted to the hospital because her liver was failing.
Okay.
And then another reason for her demise, metastatic ovarian cancer.
So hepatic, am I saying that correctly? What that means, the liver failure?
Correct.
And then the secondary cause would be the metastatic ovarian cancer.
Correct.
And again, when you're filling this out, would you look at the medication provided to Ms. McDonald at the time she was palliative withdrawn?
No.
Thank you, sir. I have no further questions. Jaime, I'll leave these up here if I need them. And he's got his copy still, so that'll be easy.
Please court. So good morning. Dr. Shand, right?
Correct.
Doctor, I'm going to try and make this as brief as possible, okay? Doctor, I know you testified that you saw Brandy McDonald, but you don't remember her, correct?
Correct.
May I approach, this is just progress note, so you don't have to go through this process. Doctor, fair to say you don't remember what you put in your progress note dated January 14th at 13:42 Eastern Standard Time?
I don't remember.
Would looking at that progress note refresh your recollection?
Which date are you asking for? Or just overall?
First page.
For the first page, so for the 12th, you said 14th.
Okay, maybe it's not the first page.
It's got all of them.
I mean, I can go to the 14th. Yeah, that's fine.
Take a look at what to the 14th and see if that refreshes your memory.
Just the 12th.
You know, let's do it this way. Let's switch.
I have the 14th there.
Actual 14th version of it.
Sure.
Let's just
Identify it.
Doctor, is your name on that document?
It is.
Right. What does it say at the top of the document? It showed you a different document, so we have to put on the record what was shown.
Sure, it's a progress note.
I understand, but in the top corner, there's some writing there. What does it say?
Joint Exhibit 5.
Okay, thank you.
Okay, doctor, is that a fair and accurate depiction of your progress note on the 14th of January that year?
Yes. Sure.
Commissioner Pellicero?
Any objection?
No objection, it's his note, Your Honor.
Okay. This impression, that's your initial impression as to what was going on with Ms. McDonald, correct?
Yeah, what you came to the hospital for.
Now, I can't see it. Can you see the plan? Okay. Can you see that okay, doctor?
Yeah, it's a little fuzzy, but yeah.
Okay. And you indicated that during the course of her stay, she became very acidotic, correct?
Correct.
She was started on Viacom, that's a form of life support, correct?
Sure.
Then overnight, her respiratory status deteriorated, correct?
Correct.
It required an ICU transfer, and I believe you referred to it on direct examination as an emergent intubation, correct?
Correct. Correct.
Now, do you recall what documents you reviewed to reach that conclusion you put in your plan regarding her having to be intubated?
I reviewed the brief notes that were previously entered by the night team.
Would you have reviewed the operative procedure document regarding that intubation?
I did not.
Okay. Are you aware who performed that emergency intubation?
I don't.
Are you aware that Dr. Husel?
Objection, Your Honor.
Sustained.
I would have to look through the records to see because I don't remember.
The ICU is where that emergency intubation occurred, correct?
I wasn't present, so it could be on the floor or it could be in the ICU. I don't remember if I wasn't there, so.
Who was the ICU doctor working that night?
Objection, Your Honor.
If you know, do you know who was working that night?
Dr. Husel?
Objection, it looks like he's guessing.
Well,
I'm
that's
just
a
saying
jury
because he might do
determination.
this.
I don't know the schedule. I mean, I'm assuming, obviously.
Objection, Your Honor.
Okay. No question pending, strike the last answer there. New question.
So fair to say, regardless of who did it, she was in life support, deteriorating, correct?
That's correct.
Required an emergency intubation, correct?
Correct.
And an emergency intubation is a form of a life-saving procedure, correct?
That's correct.
You don't know, you can't say who, but someone in the ICU at night did that.
Objection, Your Honor.
It's been asked and answered, yes, sustained.
Okay. This is, again, still referring to Joint Exhibit page 40, Joint Exhibit 5, page 46 and 47.
Is that the progress that's still pending?
Yeah, that's the second
no
page.
problem. Just wanted to make sure.
This is still your progress note, right, doctor?
Yes.
And this is your assessment of her situation, is it not?
Correct.
She's critically ill.
Correct.
She's going to die.
Appears that way.
Poor prognosis.
Yes,
You met with the mother and father.
I did.
They didn't want heroic measures.
Correct.
Palliative care consulted and the code status changed, correct?
Yes.
So you took the initiative to speak to the family from Ms. McDonald, correct?
I did.
You delivered the news to them that her death was imminent, did you not?
I said she was critically ill and anything could happen, but I
You
didn't
felt
say.
it. Oh, I'm sorry. I don't mean to talk over you. That's my fault, son. But you felt it necessary to have that hard talk with Ms. McDonald's family.
Yes.
Now let's go to your discharge summary, which would be State's Exhibit 5C. Can you see there where it lists all the different doctors?
Yes.
That's all the different doctors that were involved in Ms. McDonald's care, correct?
Some of them are partners with each other, so it doesn't necessarily mean every person saw them, but most of them did.
Fair to say you wouldn't have put them there if they had nothing to do with Ms. McDonald, right?
Correct.
Any one of these people tell you that they disagree with the fact that her death was imminent?
Objection, Your Honor.
Sustained.
Did any one of these people raise any concerns about the care that Ms. McDonald received? To you?
No.
active and final diagnosis. This is where I believe you testified what you believe to be the cause of her death. Correct?
Correct.
Sorry, yeah, head nods don't turn out on the transcript. Now, you referred to on direct examination as, or rather, when you were asked about why you don't review the medical administration record after you used your term consented palliative extubation, you felt it wasn't necessary, correct?
Can you repeat that?
You didn't feel it was necessary to review
That's correct.
the medical administration record during a consented palliative extubation, right?
Correct.
Now, to be clear, this is a terminal vent withdrawal, correct?
Correct.
And this is the term terminal. Can you explain to the jury what the word terminal means?
Terminal means that all parties have feeled it's the end of life situation. So at this point, is just to proceed with comfort measures. Just move forward.
And that comfort measures, are you familiar with what kind of comfort measures are used in palliative extubation?
Yes.
So that goes with saying that based off comfort measures, you're familiar with the doctrine of double effect, right?
No.
Okay, so when comfort measures are administered, isn't it true that you're no longer treating symptoms?
Objection, Your Honor.
Stand. We can have a sidebar.
What does comfort care mean to you?
Alleviation of symptoms, pain.
Okay, but you're not treating symptoms of underlying illness anymore, correct?
Correct.
And that's because to do so is futile at that point because death is imminent, correct?
Objection, Your Honor.
Sustained.
Why do you not treat the symptoms of the underlying illness as opposed to providing comfort?
Okay, you're asking for an opinion or you're asking for his practice?
In your practice, why do you not treat the symptoms of an underlying illness and provide comfort at that point?
I'm not understanding.
In your practice, is there any point in treating symptoms of an underlying illness at the time of a terminal vent withdrawal?
No.
Why?
It's futile.
Because death is imminent, correct?
Objection, Your Honor.
Sustained.
You don't feel that reviewing a medical administration record during a terminal vent withdrawal matters, right?
You've asked and answered that
It's
once.
a transitional, Your Honor.
Sustained. My own objection.
Why do you feel it's not relevant? Excuse me, make clear. Why do you feel it's not relevant when putting down these things in a discharge summary or what you put in a death certificate?
Because in general, like when when a patient comes in and we know what's going on, we have a reason for what would be their cause for their demise. So when they reach that terminal point, there's no reason to go through, like I said before, consented palliative extubation and what meds were given to them.
Because you know at that point that their underlying illness.
Objection, Your Honor.
Sustained.
What happens when you remove life support from someone with the type of illnesses that Ms. McDonald happened to have?
You die.
Right? Quickly, right? Based off her
Objection,
conditions?
Your Honor.
Sustained.
Can you predict when someone's going to die when they're taking off life support?
No.
Could be moments, right?
Could be.
Minutes.
Could be days.
Don't know though. Could be from anything from a second to a week, right?
Sure. Yes.
But what you do know is that when you remove life support from someone who needs it, they die.
Objection, Your Honor.
Sustained.
One moment, Your Honor. Nothing further.
Redirect.
Thank you, Your Honor. Can I talk about the progress now?
Would you have long because we're here for a break?
I mean, it depends on his answer. It may be a little longer than I would typically go, so we could do a break now, Your Honor.
Let's do a break. It's been a while. Okay, ladies and gentlemen, let's take 15 minutes. We'll get started at 5 till 11.
All right.
Have a great break. Enjoy the break, guys. Okay, Todd, we're gonna get back to you pretty quickly here. You're currently on the stand, you can't discuss your testimony. So if someone comes and asks you about how you testified, you're disregard the question. Understood? Okay, you can go on now and relax for a second. Hold on, don't go too far, we're gonna try the record here. You can go now. Anything for the record?
Not at this time, Your Honor.
You're not on the record, he is. Okay, thanks.
I'm not trying to ignore it.
It's okay. You still weren't on the record. My biggest.
No. Oh, that was a question. Whereas a demand. Two guys.
No, one stays. Big difference.
Yes, no, I know. One of my favorite cookies growing up was my grandmother's tea.
Oh, yeah, this time. It's fun to make too.
They were one of my favorites.
Them and the kiss gumdrops. Why don't you call here and see if you can do something with this?
See if you can help me.
Hey everybody, sorry it's been a long morning, but I finally got out of stuff. Yeah, so they're having to go through all these guys and these internists and the hospitalists. Yeah, if this is really what it's going to turn into, I saw some tweets while I was in court. You guys chatting? Yeah, I'm going to bail on this until it gets spicy again because there's no point. If we're really going to cover all this, like I think I mentioned that before, if we're covering every single record like this, I don't want to be involved. Also, if you notice today, that was one of Jose Baez's, I wouldn't say lackey, but one of his associates, attorney-wise. What's the guy's name? But Jose wasn't doing it. I think that could tell you a lot about what's going on here. This wasn't the most important guy in the world to worry about. So I'm not going to get all fired up about it either. So Yeah, I know you guys were mentioning Crystal, whatever her name is. Critter sent me some stuff. I'm probably gonna, I'll take a look at that today when I get some free time at my lunch, and we'll probably skip down to that one. No, there's no infighting here. Um, I'm yeah, and it really is. It's getting repetitive, and I'm getting a little surprised that the judge isn't. I mean, also, you know, I think the problem is the state has to prove all this, and they're not. I don't know, but yeah, I'm not going to sit through all this that way the whole way through. So yeah, I'll be working on the. I'll probably look at this Crystal. I think it's Daniels coming up and do that one just because. Yeah, this is a snoozer at this point. No, not Crystal Kaiser. No, that one I don't think is going to get televised as much. It's what's this lady's name? I forget already now. Um, but yeah, I'm willing to bounce around and take a look at something else. Oh my god, my allergies are killing me. It was horrible in trial today. Crystal Daniels is her name. So I'll take a. Um, so yeah, Crystal Daniels is on the murder. She's facing murder for her 5-year-old son. You know, she's been accused of like aggravated child neglect because dad was convicted of murdering the kid. Although the body's never been found, and they still haven't found the little boy's body for a 5-year-old. Mom and dad turned on each other. Dad's already been convicted, and she starts hers. So yeah, I think that'll be a pretty good one. But there's been a gag order in place, so we don't know a ton about the case. So yeah, she's starting trial up. I think I'll cover that. That sounds interesting. That'll be interesting to go forward on. So the judge has his own court stream. Is that what I understand? Um, Critter and Little Miss, if you guys can like work on that together and get me the info, I'd be happy to put it together. And Rennie and I can do it. Rennie's a little under the weather today, so I had to take care of some stuff and set this up. It's hard to set up over the phone, but I did. um, and then I got to figure out how to rework this now that I'm sitting in my office. Yeah, from what I read, I just read an article. Little Miss, I kind of had it read off to me. I used the reading app. Yeah, that's really creepy. Nobody's willing to talk about what happened, and that's sad. It's tragic. Oh, so this judge has his own. Oh, that's interesting. It looks like this guy has his own. Huh. I'll give this guy a shot. Wow, he's an older judge too, but he's going all out with this. Yeah. Oh, I'm impressed. Definitely give him a shot. I will just warn you guys though in advance. I have a trial that starts next week, and it's a stalking and felony stalking and felony assault trial. That's going. I have not been told that's not. I've been told that's going to happen. There's no fooling about. So if that doesn't go, well, then we're in business. But as far as I know at this point, it is. So let me actually find out about that, because it might just be Rennie running it. Because if I'm in trial, guys, I am not going to be anywhere near this, and I apologize. But yeah, I know some district courts do, but some of them are very bad about it. Or like with Judge Schroeder, it's the camera's just on Judge Schroeder when it's in the Wisconsin court thing. So, but no, I'll give him credit for trying to keep everything active and available for people. That's hard, and not a lot of judges do it that way. Some judges only do it for trials, and sometimes it sucks. So I just played one of his videos really quickly on quiet and then mute, and it looks like it'll work. And even if we'll try his streams, if it doesn't work, then we'll try if it doesn't work there, we'll try however we can get it. But yeah, we'll give it a shot there. Definitely not going to have to worry about a cease and desist letter from the judge. But yeah, like I said, guys, I just wanted to give you the heads up next week. So if stuff happens, I may have to, well, actually, I'm sorry, but it'll probably be like this. I'm going to be stuck in trial mode, so I won't really be able to jump in until afterwards, and then I'm going to have to catch up. So I'll figure out how I'm going to catch up. I don't know how, but I will. Actually, are we back? Let's see. If I can figure out how to do this right.
Because you guys do that a lot, so.
Nope, they're still not. Still not working yet. They're still screwing around. No, I just wanted to give you guys a heads up. Yeah. And it's actually going to be a fun trial. I think I can win it. So, at least part of it. So, we shall see. Let's see what else is right here. Bad camera angle. What judge? I am in front of. Oh, you guys want to know where I'm at? Oh, I don't know if there's a trial stream, and I'm not sure. I want you guys to know there's a trial stream. Oh, you guys crack me up though. I am in front of Judge David Schroeder in Ashtabula County Common Pleas Court. That is in Ashtabula County, Ohio. That's, if you don't know where that is, if you can picture Ohio in your head, I'm way up in the northeast tip, way up in the corner. So, yeah, it looks like they're having smoke and joke time right now in court. So, No, I have an issue with when I'm at my office, miss, I'm using my laptop and it doesn't I can't get the camera to work. So I just shut it off for now. Um it's weird, but I don't try to fight it. No, he's not related to Bruce Schroeder. Oh, Pamela used to live in Madison? Okay. Ashtabula County Common Pleas Court. So, Eric, if he's related to Bruce, it's definitely not through his view of the rules of evidence, because Judge Schroeder's pretty by the book. My Judge Schroeder's by the book. And it's consistent and predictable, which is the biggest thing. So, I'm glad you guys like the so I'm gonna unmute it just ready. I have to step away and I don't want it to burn us otherwise.
That's not happening. Just because he is doctor and brought his name to 3 gets his DUI. Are you ready, Judge?
Yes, sir.
Judge?
Yes.
All right.
Ladies and gentlemen, you can be seated. Ladies and gentlemen, of the jury, I hope you had a good break. We're going to continue on with the testifying. Ms. Starr.
Thank you, Your Honor. And Dr. Chand, I'm going to direct your attention to what was labeled by defense as Joint Exhibit 5, page 46 to 47. Can you identify this for us again?
It's a progress note, Brandy McDonald.
Okay, and I'm going to ask you again to speak up a little bit.
Progress note, Brandy McDonald.
And what is the date of this progress note?
The date is January 14th.
And what time did you make this progress note, sir?
Looks like just a little bit after in the afternoon.
And this would be the same date that she dies, is that correct?
I believe so, yes.
All right, so I'm going to direct your attention to the second page of this progress note that you discussed on cross-examination. The patient is critically ill, poor prognosis. Tell us what you did here.
Well, my main review, my main thing that I did here is really talk to all the consultants and really talk to the family.
Okay.
That was my main concern.
All right, and I note a palliative care consultant code status DNR-CCA. Explain to us what that is.
So I consulted the palliative care team to help us, but it looks like at this point, I mean, they didn't even see the patient. But I changed the code status after talking to the family to DNR-CCA.
What does that mean to us, sir?
The A means that after discussing with the family, that they understood she was ill, and we still would do everything to save her essentially. But if her heart naturally stops on its own at any point, we would not perform CPR or any heroic measures.
And in looking at this note, it looks like you had discussions with the family regarding how long they wanted to work towards seeing if this patient could be saved or not. Is that accurate?
According to the record, yes.
And what was that time frame they were looking at this point?
Like 24, 48 hours.
Is there in the Mount Carmel system at that time, Mount Carmel West, was there a different DNR code that could also be implemented? A DNR CC, I think is what we've heard it called.
CC, correct, yes.
What does that mean?
That essentially means we're not treating anything significant, just focusing on comfort care, comfort measures.
So at this point, the family wants the treatment still.
Treatment still, but just no CPR.
Now, can you tell us, you said you consulted with all of the other doctors, am I accurate in that?
Yes.
And then you had the talk with the family. How do you typically approach this type of issue with the family in your practice?
Yeah, it's obviously a very sensitive topic. So you ask the family if they want to, speak separately or in front of the patient, and just kind of briefly go through everything that we said so far, which would mean imaging, labs, and then what, if any, summarize for them what the consultants would say or opinions of what they recommend, and then essentially give them how we may feel this may progress towards, and help them, guide them towards what would they want to do if XYZ would happen.
Palliative care consult, what does that mean to us? I know you said it didn't happen in this case, but if it had gone on longer, what would have happened?
Essentially a team that would do what I did already.
Okay.
Which was talk to the family and guide them through the process as far as prognosis and helping with anything and support and helping with the code status.
Is this type of conversation something that you would consider a serious matter?
A what?
A serious matter?
Yes.
Is it something you would do on an emergency basis?
Yes.
Why? Tell us that.
Because things sometimes happen very rapidly, and we prefer input from the family as if this would happen. So they're not shocked and surprised that nobody said it, nobody told us anything. So they're just so they're informed.
Okay. And in this case, CCA is what the decision was.
Correct.
In your practice, Dr. Shand, have you ever performed a palliative extubation?
I have not.
All right. Thank you, sir.
Thank you.
I have no further questions.
Can we step down?
Your Honor, I didn't open anything up on redirect that was already
Okay,
on cross.
stop. Ladies and gentlemen, talk amongst yourselves. Let's go sidebar. Step down, thank you.
Leave this here?
Yeah, leave it there, we'll clean it up. You can have your mask, I don't need it. Call your next witness.
Thank you, Your Honor. The state calls Dan Baker to the scene.
And just to update you, the administrative order is in effect. I'm in the process of trying to negotiate that front glass. It's my understanding from consensus from you all, the second row front glass was being asked to be removed. I didn't hear any objection to removing the box up here, the front shield, so we get better audio. Okay? I have to leave the framework up. So we're in negotiation on that. I do have the ability to tell you to wear a mask or not. It's strictly under my thing. I want you all comfortable. If everybody's comfortable with it, fine. If everybody's not comfortable with it, we can deal with it accordingly. You guys are a group to me. Okay? Each individual, but you're a group. Okay? You'll see people throughout the courtroom that may not have them on, that did have them on before. It's about their comfort. Okay? So that's an update for y'all. You ready?
Yes, sir.
And if anything I said about the glass or anything you don't agree with, tell Darcy. You need to raise your right hand. You solemnly swear to tell the truth, the whole truth, and nothing but the truth, so help you God. Okay, go ahead and make yourself comfortable there. Now you have an aerial mic there in front of you, so you have to enunciate, okay? It'll pick you up.
Okay.
We're also doing plexiglass, so the louder you are, the better off you are. We don't hold points against you for screaming at us, okay?
Okay.
Okay? I need you to state your name for the record and spell your name so that my court reporter can get used to your diction.
Yes, my name's Daniel D. Baker IV, Daniel D. Baker IV.
Okay? Ms. Sapp?
Thank you. What do you do for a living?
I'm the Chief Forensic Toxicologist at the Franklin County Coroner's Office.
And how long have you been so employed?
At the Coroner's Office in Franklin County since 2007, but I've had various roles in the Forensic Toxicology Lab.
Can you tell the ladies and gentlemen your various previous roles in the forensic toxicology lab?
Yeah, I came down as an assistant toxicologist in 2007, was promoted to toxicologist, then assistant chief toxicologist and quality assurance manager. And since 2014, I've been the chief toxicologist.
And what type of education and training do you have to become a toxicologist?
Yes, I have a bachelor's degree in forensic science from Youngstown State University. I have a master's degree in pharmacology and toxicology from Wright State University. And I'm board certified by the American Board of Forensic Toxicologists.
And how long have you been a toxicologist? And then how long have you been board certified as a toxicologist?
I've been a toxicologist for 20 years, and I've been board certified, I believe, since 2006.
And have you ever been found to be an expert in any Ohio courts in the area?
Objection. Sidebar.
Okay, you're on?
Yeah.
I'll permit the question.
This is not a expert witness, Your Honor.
Well, I don't know this yet. Mr. Zion?
Have you ever been found to be an expert in any Ohio courts in the area of forensic toxicology?
Okay, now, are you going to be using him as an expert?
Yes.
Okay, let's go sidebar. like they're good too. We're trying to be a healthy snack. It's all Miss Darcy's fault.
I started out with the candy.
Yeah, she had the chocolate, and now we're the dried figs and dry dates.
Apples and oranges.
Yeah, but that gets messy. Okay, we're back on the record. Mr. Zion?
Back to my last question, just for transition. Have you ever been found to be an expert in the state of Ohio in any common police courts?
I've been qualified as an expert in forensic toxicology in approximately 15 courts.
Thank you. All right. So what do you do at the coroner's office on a day-to-day basis in general, if you can explain to them? We'll start with that. What do you do and then we'll go to why you do that.
In forensic toxicology?
Yes, please.
Yes, so I direct or lead a team of forensic toxicologists, and we perform a battery of toxicology tests on decedents, basically blood and urine, body fluids, to determine whether drugs or poisonings could have caused their death.
And how do you do that?
Well, we use a number of analytical instrumentation techniques. It includes gas chromatography, mass spectrometry, or liquid chromatography, tandem mass spectrometry. But
These wants to know how you get the samples.
Oh, I'm sorry. So samples or blood, urine, tissues are collected at autopsy or examination of a deceased individual, or from, they are subpoenaed from hospitals in the event a person was transferred to a hospital first.
All right, explain why the difference between the two, taken at time of autopsy versus subpoenaed from a hospital.
Yes, so it is standard protocol and actual required practice by the National Association of Medical Examiners for our investigators to subpoena and acquire samples at hospital admission. This is because while a person is hospitalized and remains alive, their body is continually breaking down and eliminating drugs. Therefore, that evidence of possible drug abuse would be gone by the time the person ultimately was deceased.
So what is your understanding, based on your training and experience, of how and when these samples of the person's blood, urine, and other things are collected? How is that done? When is that done at the hospital, based on your understanding and experience?
Blood samples are commonly taken at the hospital to do routine tests, typical blood tests or diagnostic tests to help a doctor diagnose a person's state or disease.
When they're first admitted?
First admitted, and then periodically throughout their stay in a hospital, physicians will order additional tests, maybe to diagnose a person's disease.
And for the purposes of your examination and based on the standards that you operate under, what blood and other samples do you want for your examination?
The first available sample closest to the incident that caused them to be transported to the hospital.
Okay. And is there a word for this type of blood as far as its time regarding death?
Yes, antemortem or before death.
So could you spell that for the record there?
ANTEMORTEM.
And when you subpoena this, you want, like, when they come in as soon as they can, the soonest blood sample, et cetera, that you have, right?
Yes, those would be the closest to the incident that caused them to go to the hospital.
All right, and then I think you were getting into the scientific test that you're able to do on those samples.
Yeah, so once those samples are received and inventoried, they're barcoded so we can track their location and process as they're being tested. they are subjected to a routine battery of kind of preliminary screening tests. And then based on any presumptive findings, we'll follow that up with more specific confirmation tests.
All right. So were you so employed and so working back in April of 2017?
Yes.
And did you have occasion to examine the ante-mortem blood, that being the blood you just described, the first samples taken from a man named Ryan Hayes?
Yes.
Showing you what I had marked for the record as 18P as in Papa. Multi-page document. Do you recognize this document?
Just for the record, that states 18?
It states 18P.
Okay.
Yes, I do.
And what is that document?
It is the coroner's report, findings of facts and verdict.
All right.
It is the autopsy report, findings and diagnoses.
And does that appear to be a fair and accurate copy of that document?
And it's also the toxicology report.
Hold on, we got an objection.
How could you authenticate something you didn't write?
Okay. We've been through this, overruled.
Go ahead, sir. Does that appear to be a fair and accurate copy of the autopsy report and findings?
Yes.
And is your report a part of that document?
Yes.
And where does your report begin?
On page 6 of this packet.
All right. And how many pages does your report contain?
5 pages.
All right. And is that fair and accurate regarding Mr. Hayes?
Yes.
Your Honor, at this point, I request permission to publish.
Only as to his report.
Correct.
Any objection if it's limited to his report?
Subject matter, please object.
For the record, 18P attached as just described by the witness, the toxicology report. Is this what you were referring to up there, sir?
Yes.
All right, so tell us what's this at the top here? Who's Ani Ortiz?
That is the coroner of Franklin County.
All right. And toxicology, and who is Daniel D. Baker, chief toxicologist?
That's me.
All right, and who is this referred to over here and pointing to the left-hand side?
Ryan E. Hayes is the decedent.
What's this case mean?
That's a unique number assigned to this case and this person.
And what's this mean over here on this side?
That's when the report was completed and issued.
All right. And what's this sentence mean here? Can you tell the jury what that means?
It means a full toxicology analysis has been performed.
Okay. And here we have that word again. What's that word?
Antemortem before death.
Okay, before death, blood. That's what you tested in this case?
Blood, yes.
All right. Lavender top bottle. What's lavender top bottle mean?
Lavender top just refers to the color top tube. Lavender tops contain an anticoagulant called EDTA.
All right. ELISA screen, what does that mean?
That's a screening test to screen for classes of drugs.
All right, let's go through the classes of drugs that were screened for. Acetaminophen, what's that?
Tylenol?
Was it detected?
No.
What's this next one?
Amphetamines a stimulant. It was not detected.
What's this?
Barbiturates is a depressant. None were detected.
What's this?
Benzodiazepines are an anxiolytic or depressant. None were detected.
What's this word?
Benzoylecgonine is a cocaine metabolite. It was not detected.
Can you explain what a metabolite is?
Yeah, if a person or a human or animal for that matter ingests a drug or is exposed to a drug, the body breaks that drug down in order to more effectively eliminate it from the system or get rid of it.
And when it breaks it down, does it turn it into these other things called metabolites?
Yes.
All right. So no cocaine metabolite, benzoglycanine, was detected.
None was detected.
What's this?
Buprenorphine is an opioid.
Was it detected?
No.
What's this?
Cannabinoids is marijuana. It was not detected.
What's this?
Fentanyl is an opioid.
And what was that?
We had a presumptive positive indication it may be present.
Tell them what that means, a presumptive positive indicating it may be present.
Because this is a screening test, like I said, there's a battery of screening tests that are performed, and then they're followed up with more specific confirmation tests. These are different and support maybe a preliminary indication that that drug may be present.
All right, what's this next one?
Methadone is another opioid.
Was it detected?
No, it wasn't.
What's this?
Methamphetamine is a stimulant. It was not detected.
What's this?
Opiates is a class of drugs.
And was that detected?
We obtained a presumptive positive.
What's this next? This next one here?
I can't read it. Oh, if you can move it up.
Sorry.
Thank you. Oxycodone and oxymorphone was not detected.
What's this next thing?
Salicylates aspirin was not detected.
And lastly, here on this page, one.
Tricyclics or tricyclic antidepressants, none were detected.
Going to page 2 of your report. What's this at the top?
Okay, I can't see it.
Ah, you're right, Judge, you're right.
Ethanol or drinking alcohol.
And was that detected?
Yes, it was.
What about this?
Nicotine from tobacco was detected.
What's this?
Codeine is a metabolite of nicotine. It was detected.
All right, so that is the body's breaking down nicotine, and we have a metabolite of codeine.
Yes.
What's this next thing?
Morphine.
And was that detected?
Yes.
And why do we have here, it's just been before, we've had measurement or confirmation. Why do we have a measurement here?
Yeah, see, on the left-hand column, you'll see the analytical technique. Mm-hmm. All of those are conformational tests.
Okay.
GCMS or gas chromatography mass spectrometry. And yes, we confirmed the presence of morphine at 83 nanograms per milliliter in that blood sample.
All right. So these are the confirmation tests. The first page of your report were the screens. Now we're getting into confirmation tests.
Yes.
All right. What's the next thing that I was tested for in the confirmation tests?
6-monoacetylmorphine is a heroin metabolite. It was not detected.
Next.
Codeine is another opioid related to heroin, and it was not detected.
Next.
Hydrocodone and dihydrocodeine are opioids, and they were not detected.
Next.
Dihydrocodeine is a metabolite of hydrocodone. It was not detected.
Next.
Naloxone is the antidote to opioid intoxication. It was detected at 26 nanograms per milliliter in that blood sample.
Hypothetically, if this person was given naloxone in an ambulance to the hospital, would that account for that finding in your confirmation reports?
Yes.
And tell the ladies and gentlemen of the jury your understanding of why naloxone is given and what its effects are.
Well, naloxone is given routinely now because opioid-related deaths are so prevalent. This naloxone blocks the opioid receptors and causes the opioid in the person's system not to have an effect anymore.
Okay. All right. The next section, what does this mean? Blue top blood taken on 4/2/17 at 1:41 a.m.
That was another blood sample utilized. It, I believe, is the same time and date as the other blood sample. Mm-hmm. What happens is hospital samples, a lot of times there isn't much volume there. So as we run out of volume in one sample, we need to go to another one and proceed with our testing and confirmation.
All right. Why did you test for alcohol again?
That was to confirm the presence of the first sample.
From this one up here at the top?
Yes.
All right. And to give people a perspective, 0.10, is that like what people might be familiar with breathalyzers, things like that, OVI?
Yeah, 0.08 is the legal limit, so that's just over 0.08.
Okay. And then what else is confirmed here?
We confirmed fentanyl at 1.1 nanograms per milliliter.
All right. What's this next thing?
A norfentanyl is a metabolite of fentanyl. We did not detect it.
All right. What's this last thing here?
Carfentanil is one of the strongest opioids known. You may know this as an animal tranquilizer. It's not used in humans and is an illicit form of fentanyl.
All right, and this is taken prior to any hospital, this is taken when he gets to the hospital. So if this is in his system, this is something he's illicitly taken prior to arriving at the hospital.
Yes.
All right. Why don't we have an amount?
We do not quantify carfentanil just because its mere presence is significant enough to cause a person's death.
All right. What's next?
All of these tests, this next battery test is performed in the vitreous humor fluid, which is fluid obtained from the decedent's eyeball. All of these are metabolic or clinical chemistry tests and are used for the purpose to diagnose diabetes, kidney failure, or liver failure.
All right. So I'm hoping that is post-mortem?
Yes, it is post-mortem.
All right, because they actually, yeah, because it's from someone's eyeball? All right. Let's talk about the last page here. What is this?
Move it down just a little bit.
Oh, yep.
This was testing performed in post-mortem urine from the decedent, and we tested a gray top urine sample, and we only detected cotinine, the nicotine metabolite, by GCMS in this sample.
All right. So the blood samples that confirm the amount of fentanyl, and in this case, carfentanil, that's taken as it gets to the hospital. That's the purpose of this.
Correct.
All right. Why are you doing these things, and how are they used by the coroner in determining cause of death?
The forensic pathologist, they use three main types of information to come to an opinion as to a person's cause and manner of death. They first review.
Your Honor, he's not a forensic pathologist.
I would agree, sustained.
Do you have an understanding of how your reports are used? Why are you employed? What do they do with your report? Do you have an understanding of that?
Yes, I have a general understanding.
And I'd ask him to be able to testify as to his general understanding of how his reports and his work is used by the forensic pathologist.
Okay, this is his understanding of that.
Correct.
Okay, go ahead.
In general, the forensic pathologist looks at three main areas of information. Number one is the circumstances surrounding a person's death, the scene investigation, or medical history. The second is their autopsy findings of disease or trauma. And the third piece of information is toxicology results that would substantiate or refute any type of drug or poison in that person's system.
Ante-mortem as they arrived at the hospital.
Yes.
Thank you. Showing you what I've marked as State's Exhibit 18O has an Oscar. Do you recognize 18O?
Yes, I do.
What is 18O, please?
This is the coroner's report, findings of fact and verdict of James Timmons. The post-mortem examination report, findings and diagnoses.
And is a toxicology report part of that report?
Yes.
And did you perform that toxicology?
Yes, I certified the report.
And is that on the back of that, is that report contained therein?
Yes.
And is it there now?
Yes.
May I publish it?
Objection?
Same subject, same objection.
Okay, overruled, you may publish.
Now, you said when they come in off the street, they take the blood samples and stuff at the time of autopsy, but when they come in from the hospital, like Mr. Ryan, they take it ante-mortem as they arrive at the hospital. What's the situation with Mr. Timmons?
Both are accurate. So samples are not only subpoenaed and acquired from the hospital, but other samples are taken at the postmortem examination.
Okay. Were these samples that were taken, that were tested by you on Mr. Timmons, were they ante-mortem taken at the time that he arrived at the hospital?
Thank you.
Sorry, yeah, you gotta look at stuff here, I'm sorry. Look, publishing page 1 of 5, the attached toxicology report that was just authenticated.
Yes, this shows that ante-mortem blood from James Nicholas Timmons was tested.
On what, and the sample was collected on what date and time?
October 22nd, 2018 at 21:47 hours.
All right. And just, we'll go through this very quickly. Same type of screening as Mr. Ryan on page 1.
Yes, the ELISA screening tests showed a presumptive positive for benzoylecgonine, the metabolite of cocaine, and marijuana.
All right. Are any opioids in his ante-mortem blood? I mean, when he arrived at the hospital? On page 1 here.
Not on page 1.
Okay. So the screens are positive for a metabolite of cocaine. What does that tell you as a forensic toxicologist regarding his ingestion of cocaine at some point?
That individual was exposed to cocaine prior.
His body
to
is
the collection.
processing it, and that's what's found?
Yes.
And the cannabinoids, that's just marijuana, however he took it?
Correct.
All right, going to page 2. Same test as we saw with Mr. Ryan at the top there.
Yes, these conformational tests, ethanol was not detected, fentanyl was not detected, norfentanyl was detected.
What's norfentanyl?
It's an inactive metabolite of fentanyl.
All right, so once again, as a forensic toxicologist, what, if anything, can you surmise from Mr. Timmons at some point prior to coming to the hospital, his ingestion of fentanyl?
That he had been exposed to fentanyl.
And his body's breaking it down, and that's what's left?
Correct.
At the time he arrives at the hospital. Okay, and then what's the rest of these tests here in the section pop, gold pop serum, what's that?
That is another hospital antemortem sample. Again, just a different type of blood tube. And it's similarly, what is occurring is we're running out a sample from the gold top serum and going to another gold top serum.
All right.
This is at a different time.
A different time at the hospital?
It's 2 hours later, yeah. Or
Okay.
approximately.
So we see ketamine. What is ketamine?
Ketamine is a dissociative anesthetic administered to people for the purpose of medical procedures and, to anesthetize them. So
All right.
I'm not aware.
So can you surmise, based on your training and experience as a forensic toxicologist, knowing that he came from the hospital, that they had begun therapeutic administration of drugs at this point?
Speculation.
Based on his training and experience, Judge.
Okay, we don't do runnings. Let's rephrase the question.
What, if anything, can you surmise, based on the timing of this and your knowledge of these drugs, how the ketamine got in there?
Objection, speculation.
This is our law of cases, Judge.
Can't guess.
I understand, okay? This is according to his training.
Yeah.
Okay, it's permissible.
From this report, the only thing that can be surmised is that this individual was exposed to ketamine sometime prior to this blood sample being taken.
All right.
We have access to medical records, and in the medical records, I know that this individual was given ketamine prior to this sample.
No, he's silent.
Okay, overruled.
Thank you. Moving on to the next section. what do we have here in the gold top serum sample 2332? Is this a different time? Is that what that is saying?
A different time from what?
From the one that we just looked at?
Yes, it is.
So you're running out of samples, and as the hospital continues to take samples, you're continuing to test?
Yes.
All right, so what do we find now?
We only find 11 more 9-carboxy delta 9 THC, an inactive metabolite of marijuana.
All right. Now, down here, antemortem urine. So this is before death urine. So we're out of the blood. Now you're looking at Mr. Timmons' urine that was collected at this date and time?
We didn't go to the urine because we were out of blood. We test blood and urine on every case if it's available.
All right. And what do you find testing his urine that was collected on 10/22/18 at 21:47?
We find the presence of fentanyl, nicotine, and codenine.
Cigarettes or tobacco, right?
And ketamine and its metabolites.
All right. So ketamine, that anesthetic, dissociative anesthetic you described, and then these are the body's breaking down.
Yes.
The ketamine. Right. Finally, moving to page 3 of your report. What else do you find in Mr. Timmons' urine?
You see your hands on me.
Oh, there we go.
Cocaine and its metabolites, benzoylecgonine and methylecgonine.
All right. And once again, are there amounts here? Like how much is in the system?
Not in the case of urine. Those urine results, the amount is not interpretable.
All right. You can just say it's there or not.
Exactly.
So, Doctor, based on your training and experience as a forensic toxicologist, for how many years now at the coroner's office?
Since 2007. And I'm a forensic toxicologist. I'm not a doctor.
Oh, I'm sorry. I think I called you a forensic toxicologist. Under what circumstances do patients or do blood samples come to you as part of an autopsy? Are you aware of what circumstances?
Routinely on every case.
Everyone that dies in Franklin County gets an autopsy?
No, but everyone who dies and has an autopsy or an examination by a forensic pathologist, they obtain postmortem samples for toxicology testing.
And what is your understanding of why someone would receive an autopsy, why someone's body would receive an autopsy? If you know, if you don't know, that's fine.
That's determined by the forensic pathologist who manages the case.
Okay, sustained. Strike the answer. Okay, stop. Strike the answer. New question.
Do you know how those determinations are made?
That's up to the pathologist's judgment.
All right. Thank you. I have no further questions.
Cross.
Mr. Baker, when did the state of Ohio tell you you're going to be called as an expert witness in this case?
I believe 3 weeks ago.
3 weeks ago. Did they ask you or provide you with additional materials to review prior to testifying?
No.
So simply just the report that you have here, correct?
Yes.
Okay. Now, let's go into your report for Mr. Hayes, which would be State's Exhibit 18D. For Mr. Hayes, the first blood taken was on April 2nd, 2017 at 1:41 in the morning, correct?
That is not necessarily the first blood taken. That's the first blood that we received that was closest to the incident that caused them to go to the hospital.
Okay, so just to be specific, this is the first blood listed in your report that you analyzed?
Yes.
Okay. And so you're aware then that Mr. Hayes died the following day, not on April 2nd, right?
I know that some time period had passed since his admission and the time that he died.
Okay. But you reviewed
If it's a day,
you reviewed the medical records, right?
I can tell you exactly. Well, it's actually in this exhibit, the date and time of his death.
Stop. Let's start with another question.
So just to confirm again and not to waste everyone's time about this, fentanyl and opiates were confirmed to have been in that first blood you analyzed, correct?
Those are presumptive positives that you're pointing to.
Presumptive
That gives us an indication that fentanyl or opiates may be present.
Okay, but that's why you do all these other tests, right, to confirm it?
Yes.
Okay, so based on these other tests, again, it was confirmed that he had fentanyl in his system, right?
Yes.
And that was when he arrived to the hospital, the blood that you analyzed, right?
Yes.
So he walked into the hospital with these drugs in his system. Actually, let me clarify. He was taken in an ambulance after overdosing on these drugs to the hospital, right?
I'll permit the question. Do you know?
I know that this death was presented to our office as a suspected overdose.
Okay. Without getting into what other people said, because you reviewed the medical records, right?
Objection, Your Honor, that's what other people said.
Okay, well, he's excluding it. Do you have a question?
Yeah. You reviewed the medical records, right?
I reviewed the medical records.
Yes or no?
In light of
Mr. Baker. Yes or no? Did you review?
He's answering your question. Go ahead.
While that is correct that I reviewed some medical records, I reviewed the medical records specifically to substantiate toxicology findings by our scientists.
Okay. So then you would be aware then that he came to the hospital as an overdose, right?
That's how the case circumstances were presented to our office.
Okay.
That's what was suspected.
Now let's talk about carfentanil. I know you spoke on direct examination about how powerful it is, right?
Yes, it's
So powerful that the mere presence of it, you don't have to quantify because it kills, right?
it can lead to death, yes.
And that's why you don't quantify it when you test for it, right?
Correct.
Okay. In fact, as a toxicologist, you know that carfentanil is almost 100 times more powerful than non-illicit medicinal fentanyl, right?
I've seen various estimates.
Over 100 times, right?
Over 100 times more potent than fentanyl? Yes, I would agree to that.
Thank you. And again, that was in his system when he arrived to the hospital.
Yes.
As well as ethanol, right?
Yes.
As well as morphine, right?
Yes.
So to clarify, morphine and carfentanil are opiates, but different drugs, right?
Correct. Carfentanil would be considered an opioid. Morphine would be considered an opiate.
Oh, let's talk about that.
Okay.
Let's talk about the difference between an opioid and an opiate. An opioid is synthetic, right?
Yeah, traditionally, opiates are termed that way as coming from the poppy plant or derived from the poppy plant. There are many other opioids that are synthetically derived, like you say, but there are some synthetic opioids that cross-react with our ELISA assay as an opiate. So they're very closely related, but they both work on the same receptors in a human.
They weren't different. Would they call them something? Would they just refer to them all as opiates? Maybe make it simpler. Why is there even a distinction between an opioid and an opiate? Because they're different, right?
For our purposes, they're different. Opiates or opioids react on different screening tests in the toxicology lab.
Are they the same
That's
thing?
why.
Simple enough. Are they the same thing?
Your Honor, I would object to him interrupting the answers and interjecting other answers.
Okay.
There is overlap in the definition. This is
But they're
why.
not the same thing.
Well, an opioid can be an opiate, but traditionally, by a definition, opiates are derived from the poppy plant.
All right. Yes or no, are they different?
I believe there's overlapping in the definition when you categorize specific drugs.
In your experience, are they different?
Mayor, I think he's answered the question best he can.
I think he hasn't answered the question once.
Okay. Move on.
So, okay. Getting back to the opiates and opioids that were in his system, there were multiple in his system when he arrived at the hospital, correct?
Yes.
Thank you. Let's talk about Mr. Timmons. This is State's Exhibit 1810-0.
O is an Oscar.
18-0 as an Oscar. And again, everything you reviewed for Mr. Timmons prior to his death, correct?
I didn't understand the thrust of your
All the
question.
blood you reviewed was prior to his death, correct?
All the blood that we tested was prior to his death. Reviewed, I
Okay,
reviewed and certified
Okay,
results, sir.
just relax.
so you're aware then, in 1022, and having reviewed his medical records, you're aware then that he died days later, right?
Yes.
Okay. And you're also aware that he also came to the hospital as an overdose, right?
That is what is suspected, yes.
That he was found unresponsive by a family member after having been down for some time. You're aware of that, right?
I don't have the case memorized. I can review, the records of the case and tell you the specific circumstances that he came into our office.
I thought you reviewed them before you testified.
I did, but I didn't memorize the circumstances of every decedent, sir.
So you didn't care to memorize the situation when an overdose victim came in?
Okay, you're getting argumentative. Let's move on.
What records did they give you to review?
They gave me these exhibits, but I have their full case records here, and I can tell you and answer whatever questions you want from me.
Okay. But as you stand here as a state expert, you're not prepared to testify as to the condition these people arrived at the hospital.
Form of the question.
It's not
No,
that at all.
Form of the question, re-ask.
Are you aware, as you sit here today, of the conditions in which these people came to the hospital prior to your analyzing the blood that was given to you?
Yes.
So then you're aware that both came to the hospital having been found unresponsive as overdoses?
As suspected overdoses, yes.
Okay, and that was prior to getting to the hospital, correct?
Yes.
Okay. Let's talk about what Mr. Timmons overdosed on. Now, the benzo, I'm not going to try and pronounce that. That was the cocaine metabolite, correct?
Correct.
Cannabinoids, marijuana, right?
Yes.
Okay. Now, you have the metabolite for fentanyl.
Correct.
Okay, and this is again prior to him getting to the hospital, or the first blood that you analyzed here, right?
Yes, prior to his death, yes.
Okay. And you said that based off your review of the medical records that you came to a determination that he was given ketamine upon his arrival, right?
Yes, that's documented.
Okay,
There in the
so
medical
tell me how that makes sense. Ketamine is used for sedation, right?
I'm not a medical physician. I don't know why it makes sense whether he was administered ketamine or not. I have the medical records that shows the date and time it was administered, and I can show you those.
So just to clarify though, you didn't just testify in direct examination that he was given ketamine for therapeutic reasons? But now you can't talk about it?
I never said therapeutic reasons, I don't believe.
Your Honor.
So, overall for right now.
Who gave him the ketamine? You know that?
Not off the top of my head.
What's this meth thing here?
Methylectinine, it's a metabolite of cocaine.
Okay, so another metabolite for cocaine, right? And then we have your confirmation tests, right?
Those are urine tests, GCMS tests, yes.
Okay. Fentanyl, right?
Correct.
Ketamine,
Yes.
various forms of ketamine.
Metabolites, yes.
Cocaine,
Yes.
and the metabolites for it as well, right?
Correct.
As a toxicologist, you learn the effects of drugs on people, correct?
Yes.
People who use the drugs that James Timmons and Ryan Hayes use develop tolerances to them, don't they?
Can you repeat it? I didn't hear you.
People who use opiates develop tolerances for them, don't they?
Objection, Your Honor.
If you can answer.
Yes, they can after prolonged use, but that is reversible. So there's no way to know whether this individual had tolerance at this time.
Oh, but you reviewed the prior medical records, right? So you know that they both have documented histories of substance abuse.
Okay, sustained.
Are you aware that it's documented in their medical records that both had a prior history, a long history of substance abuse?
No, I did not review that specifically.
Right. But hypothetically, if they did, and then you found these drugs that you found, they would have tolerance to them, would they not?
That's possible.
I'll permit it.
Can you say that again? I'm sorry?
That's possible.
Right. In fact, Mr. Hayes even had the super powerful carfentanil in his system, right?
It's been asked and answered.
Not in the context of tolerance, Your Honor.
No, it's been asked and answered.
Okay. How would a drug as powerful as carfentanil affect someone's tolerance to opiates?
Well, again, opioid tolerance is developed over time, and it is reversible.
I'm sorry, I didn't say
So
opioid.
a single,
Opioid, you said opioid again.
Judge,
So
I
it's
would object to this one.
Okay, he was answering your question. I agree. Sustained. Finish your answer, please.
Go ahead.
yes, so opioid tolerance occurs after prolonged use of opioids. However, it is reversible also, so there's no way to measure this individual's tolerance at the time of his death to any opioid. A single use of carfentanil wouldn't create tolerance, but prolonged use over time would.
And again, you're not aware of anything in the medical records that would indicate the prolonged use of drugs like this for either of these people, right?
No.
Okay. Just to clarify, hypothetically, I shoot up carfentanil. Am I not going to be tolerant to it tomorrow? Objection.
Okay, sustained.
How long till I'm not tolerant to an opioid? Hypothetically, someone with these drugs in their system, how long would it take for them to all of a sudden not be tolerant to that drug?
Okay, that's sustained.
Franklin County has a forensic pathologist, right?
Yes, we have a number of them.
And in fact, isn't it true that it's free that anyone can request an autopsy?
Objection, Your Honor.
If he knows, do you know whether or not?
I think anyone can ask for an autopsy, whether that does, just because a person asks to have their next of kin autopsies, that doesn't mean that they will in fact be autopsied.
So it's your testimony as the chief toxicologist for the Franklin County Coroner's Office that any citizen with the next of kin that requests an autopsy doesn't get it, there's a process in which they won't get it?
And let's say the forensic pathologist manages cases and they have the discretion as to perform what type of examination is warranted in the case. There are private hospitals that can provide autopsies if the case is not within our jurisdiction or realm.
Okay. Public hospital like Mount Carmel West in Franklin County, right?
Objection, Your Honor.
Do you know where Mount Carmel West was when it existed?
I believe so, on Broad.
In Franklin County, right?
I believe so, yes.
In your jurisdiction, right?
Yes.
Okay, so establishing that it's in your jurisdiction.
No, that's not what that means. When I say jurisdiction, cases that are examined at the coroner's office need to be suspicious deaths, have trauma or foul play involved, motor vehicle accidents, workplace incidents. It is very specific types of deaths, not just that someone died in Franklin County.
Okay, let's go off of what you're saying then about the suspicious deaths. These two people you reviewed were suspected overdoses prior to going to the hospital, right?
Correct.
Okay. And you only are here to testify about two of 14 different people, right?
How would he know that? Rephrase.
Were you ever asked to do this type of analysis for anyone else besides these two people?
No.
And again, it was because their death was related to an overdose prior to getting to the hospital, right?
Yes, that's how the case was presented to us. Yes.
Nothing further.
Redirect? Okay, you can step down. We'll go take lunch, ladies and gentlemen. Let's do an hour and 15 minutes. Come back at 1:15. Okay? Remember the admonition. We'll get started promptly.
All right.
Have a great lunch, guys.
So, yeah, it was interesting to listen to the medical examiner talk about all those things. Yeah, so it sounds like people were using ketamine. Ketamine is I mentioned this a little bit. Ketamine is used because it does not lower your heart rate or your blood pressure. It's actually now used on the battlefield because instead of morphine, if shock is a concern, it doesn't lower your blood pressure, it doesn't lower blood flow, which could increase the risk of shock. So ketamine is a very helpful drug. But yeah, these people who are dying, I mean, they're probably giving them everything to take the pain away. Yeah, this guy is one of Jose's associates, and is he trying to make a name for himself? Nah, I think he's just not as experienced. And he's full of piss and vinegar and wants to fight. And I mean, I'd probably come across that way at times too, wanting to, just get up there and start punching and fighting with stuff. So, I don't necessarily think that's, wrong. I'd do it too. But yeah, it's interesting, I think they're bringing up issues about, the whole autopsy process. Yep, and he works at the medical examiner's office. Sorry, Critter, I'm talking about the guy, Jose's associate. But yeah, this medical examiner, I mean, when they're talking about whether or not people get autopsies and whatnot, I don't think this guy's really in a position to answer that because he's not in charge of that. But yeah, it's this one. I don't really think, there's a reason why Jose gave it to this guy to prepare. This was not one of the big ones. This was just one that was going to get done, and they might be able to make a little bit of hay out of it. And they really didn't make much out of it. Didn't really help too much. It didn't hurt. Just these people tested positive for fentanyl in their system. But remember, they're not denying that he gave fentanyl. They're just saying he had a he had a he intentionally did it. So yeah, I don't know having these guys talk about the fentanyl metabolite does anything for the this was kind of like another nothing burger in the case. Um yeah, people in the streets take fentanyl all the time, and it also kills the shit out of them all the time. Um but yeah, yeah, there's a this is really this is kind of grinding down for me. And I read up a little bit in between things I was doing today about Crystal Daniels. Yeah, we're gonna go to that one. If this is going 6 to 8 weeks, I don't need every doctor. Like, we get it. They had fentanyl and that killed them. What I will say though is there is one part of the state law that I don't know how well it was harped on by the defense at the beginning. I gotta find it again. Can't find it right now. Tasha, this was just another, like, oh, it sounds like you guys didn't do your job and you kind of flubbed your way through it. But also, not everybody suspected anything fishy. So, I did this. This doesn't really hurt anybody. In that regard, Gabby, you're watching parole hearings. Jeez, I'd say I know those are not televised in Ohio. Um, I mean, this guy's not saying anything we didn't know. Like, oh, we found fentanyl in the system. Like, we already knew that. So, this does this witness make it more likely that oh yeah, he was being a jerk. He probably doesn't like being up there and being accused of being a hack. Nobody does. But when you look at these people testifying, does this make it more likely or less likely to prove that Husel committed murder? And this guy doesn't really do any of that. He's just establishing they did some official causes of death in an investigation. So Blandino, where can we watch this Blandino guy? I may just put that on for today. I don't know. If you guys would rather me just go switch to that. Oh, I think the ME was starting to become a dick too. But yes, the lawyer was trying to go for a kill. I mean, it's his chance to make something big happen, so he just pushed hard. So, hmm. Yeah. So let's see. Yeah, they're on for lunch. Yeah, Matt, that you can't do. That's not how experts work. So yeah, I'll give the guy credit though for trying to do that. Okay, I'm sorry, little miss, saying that he works in the medical examiner's office as a toxicologist. I apologize. So let's see here. I'm trying to find some more. Oh, hold on, guys. I have a phone call coming in. Okay, guys, sorry. I was taking care of that stuff. Tasha was asking, do I do family law? Yeah, I do family law. I do divorces, all those things, custody disputes. I don't generally enjoy them because those are some of the ways, people can be horrible to each other in criminal law, but you kind of get it and understand it. But the nastiness in family law is a whole nother level. So Matthew's saying, "Oh, the Blandino guy, his attorney's sick of him. Has motion to withdraw previously, but was rejected." Yeah, and the courts will do that, and they'll say, "No, you're sticking around." I've had that happen too, especially if you try to withdraw and you're close to trial. They'll say, "Sorry, you're not getting out." Matthew, where can I find his stuff? Because if he's going to testify, I'd rather listen to a sovereign citizen do his thing. Are Nevada judges on YouTube? Okay. I want to see this guy.
I just got a very exciting package in. Surprise!
Look at that. This is a lot more.
Wow, this is a bougie courtroom. This is fancy looking. I like it. I like it a lot. That's very spiffy. So I guess we're watching someone else's YouTube on top of YouTube here. This apparently is live right now. Oh, here we go. The judge is coming in.
Sam?
I'm sorry. I didn't forget here. One thing I want to bring to Your Honor's attention that in previous entries here to the RJC during the trial, when he goes through security, he has to lift up his pant leg to show that he's on electronic monitoring. He did not have to do that today, and is concerned that there's possible prejudice to any jurors that would have seen that. And
that is a valid concern.
So that would be
if the jurors saw him with the ankle monitor on.
Is on pretrial. He's on pretrial detention and is a bad guy, as he says. I don't know which jurors to whom he's referring to, if he has any specific numbers of the jurors that he saw, but he's asking to bring that to Your Honor's attention. Today, he did not, I guess, they made an exception.
I insisted that after discussing it, I wanted to show that I insisted they take me, and they were able to accommodate that. So that's the failure.
All right, so apparently today they did accommodate, he asked him not to have to lift his pant leg, and they accommodated. So like I said, I don't know which specific jurors he's saying that he knows that saw that, but that's,
Is he indicating any specific jurors, Your Honor? My recollection on things that we're talking about last week and all, I'd have to see their faces in order to indicate, but I can indicate. Yeah, the juror numbers. Where do you guys? Yeah, I got the juror number list here. Now, the one is.
Are you asking the court to do anything? Or you just?
I'm bringing this to Your Honor's attention. I am not, I don't have enough, if you can't identify each juror.
Please let him talk, please let Mr. Bowden talk.
I'll bring that to Your Honor's attention, that potential issue exists. Without knowing which juror, I'm not gonna have which juror.
All right, so Mr.
District Court video streams.
And Officer Hawks, you can bring him
Why can't I see those?
First, ask questions later.
Up here he goes. The defendant. Yes, that was his attorney speaking about him having an issue about if the jury sees him with his ankle monitor on, that is the same level of prejudice at times as being seen in ankle irons. It presents the idea that you've already been in custody, that you're being punished. That's something courts don't want the jurors to see because it does create prejudice. So, why is it dark? Oh, I'm going to try to find the direct stream because I don't appreciate these guys having all their junk on the screen. This is a bit much. Matthew, do you know if there's a direct stream I can access?
Thank you. Will we be seated? I'm sorry. Could you pass me the?
I don't have these. Oh, I got the post.
At this time, Susan Brown, you're going to become juror number 5. You can still stay there where you are right now, or you can sit in seat number 5. It's up to you. But I just want to make sure you understand that you are now juror number 5. Okay, does the state stipulate to the presence of the panel?
We do, Your Honor.
Is now impaneled? Mr. Dickerson?
We do, Your Honor.
Okay, Mr. Bateman?
Yes, Your Honor.
Okay, Mr. Bland, you understand we're still under the same obligation to tell the truth?
Absolutely.
And you understand your testimony being given under the pains and penalties of perjury?
Yes.
Okay, thank you. Mr. Dickerson?
Thank you so much, Your Honor. Mr. Blandino, how are you doing today, sir?
Fine.
Fantastic.
Can't complain except the state and federal courts and commissions on judicial discipline.
I'm sorry, what?
I said can't complain except for state and federal courts and commissions on judicial discipline.
You can't complain?
Yeah, except for that. I can't complain about my personal, how I'm feeling and everything, yeah.
Oh, so
I feel healthy. Yeah.
the only things that you have issues with are the state courts? Is that right?
It was a humorous thing.
I'm just confirming what you're saying.
Yeah.
The state courts?
Hey, Seabreeze, an ankle monitor is a serious
Yeah, I
issue.
have some complaints there, yes.
Okay, the Nevada Commission on Judicial Discipline you have an issue with?
Yes, actually, yes. And the judges that I complained to about that, yeah.
And the federal courts?
Right, I've got a complaint pending in the federal court.
Well, other than that, you're all good, right?
Well, yeah.
Okay, just wanted.
Thanks for asking.
Yeah, no problem. So where we left off yesterday was looking at State Exhibit 7. This is the letter that you sent Mr. Federico on May 9th.
What's a copy of that letter?
Copy of that letter, right?
Let's be accurate.
Right, 2019, right?
Right.
And what we were indicating as we went through this letter yesterday is that you had given Mr. Federico until Monday, May 15, 2019, or else you were going to be reaching out to his firm.
No, it doesn't say that or else. I don't think you're reading that properly.
Okay. So
Did you actually see it or else there?
therefore, consistent with my beliefs, I will send a copy of all relevant documents to the Olson, Canny, Gordley, Angulo, and Skaversky unless I hear from you by Monday, May 15, 2019.
Unless is an or else, though. Are you seeing that unless is the same as or else?
That's what you said, though, right?
No, that's what I wrote.
Okay. And Attached to that particular letter, you included some exhibits, right?
Yes.
And this would be Exhibit 1F, as you titled it.
Yes.
This right here, you included what appears to be United States Court of Appeals for the Ninth Circuit case involving Kim Blandino versus Douglas Furman in his capacity as a state of Nevada judge. Is that right?
Yes. And in his individual capacity.
As
And
well
Terry
as,
Weinberger, doctor.
okay, great. And so with that, you also included an amended order from the same case.
Exactly.
Okay. And you included those because you wanted to make sure that Mr. Federico saw them.
Well, I thought it might be helpful to him.
Just to know what you can do, right?
Know what I could do? No. I wanted to know what I had done. I mean, that's what I had done.
Because you're a serious person.
Well, actually, I'm pretty comedic. A lot of people find me very funny.
Okay, but you're serious here.
Well, yeah, but my thing has always been, if you're not having fun, you're not doing it right. And if you're not doing right, you're not having fun.
Let's talk about that.
Yeah. Happy to.
All of this was fun to you.
All of this, what is this?
Everything that you talked about doing with Mr. Federico, you had fun doing it.
I have fun no matter what I'm doing. If I'm being tortured, I can have fun. I was tortured at Lakes Crossing and I had fun.
You're having fun right now
Yes,
because you enjoy
because
it.
if you're not having fun, you're not doing it right. And if you're not doing right, you're not having fun. I stated that specifically. Every marshal in this building just about knows that. It's my catchphrase, but it's true.
Yeah, we're gonna stick with this. It's gonna be more interesting
So,
in cross-examination.
May 15th comes and goes, right?
It comes and it goes.
May 15th,
Every day
2019
comes and
goes, and you
Oh,
don't.
you mean in reference to the letter I wrote?
That's correct.
In other words, May 15th ticks off and May 16th is the very next day. Is that what you mean?
Exactly.
I see.
And that happens.
Okay.
That's correct,
Okay.
right?
Yeah, that's how time works.
And you didn't hear from Mr. Federico.
No, I didn't.
And so on May 16th,
I mean, to my knowledge, I didn't. Let's put it that way.
right. So then on May 16th, 2019, you made good on your threat.
Could you describe what you meant by made good and then what you mean by threat?
So I'm asking questions, but I'll do that for you.
Oh, that's.
I'll show you here. State's
Mr.
Exhibit,
Blandino.
State's Exhibit
Yeah,
8.
I mean, you need to cut the commentary out and just answer the questions from the district attorney, okay? Thank you.
State's Exhibit 8, you see this right here?
Yes.
This is May 16th, 2019 at 11:39 a.m. Email that you sent, isn't that right?
No, it's not actually true. I can't answer yes to that because at the top of this, I don't have anything to do with this top above that, the lighter line. You got the heavy line right above that says Michael Federico. I had nothing to do with that. That's not me.
Sure, right below that.
And then when it says from Michael Federico, sent May 16th. Let's see, is that from my email chain? I don't know if that is or if he added that.
May 16th, 2019, you sent a letter to Mr. Federico's law firm, correct?
I sent an email.
With an attachment.
Yeah, but an email's not the same as a letter.
I will be, Gabby. So what did this guy do? I'm trying to find his case. I
So
can't
you
find it
sent this
online.
Email right here, May 16th, 2019, 11:39 a.m.
Right.
Okay, that's your email,
That's my name right there before you.
right? Kim Blandino's your name.
What's, I never mailed to? My email is after the, is that a colon or semicolon? Now, my email is after that colon or semicolon. I can't make it out on the screen.
Got it,
If I could look at the original, I could see if that was a colon or semicolon.
got it. You want me to zoom in for you?
Yeah, let's do that.
Let's
Because I
do that.
mailed to Is that how my email goes? I don't know. So that's, yeah, mail to, and then colon, and then that's my email continuing on, Kim43792.
Okay, so you sent this email to Jim Olson, Walt Cannon, John Gormley, Peter Angulo, Mike Staversky, and Michael Federico.
Right.
You titled the subject line Proposed Settlement Issues.
Yes.
You said, please see 3 attachments for review, correct?
Yes.
You included your name and your phone number.
Right, yes.
Same phone number that you've used everywhere.
Yeah, I've had it for a long time.
Okay. You turn the page, we have your attachments that you sent to the firm, Olson, Cannon, Gormley, Angulo, and Staversky.
Mm-hmm.
That's a yes?
Oh, I'm sorry, yes.
You dated this letter May 16, 2019.
Right. Yes.
You addressed it to Olson, Cannon, Gormley, Angulo, and Staversky, and CC to Michael Federico.
Yes.
You indicated that it's from you,
Yes.
Kim Blandino,
Yes.
and you titled the subject, Follow Up to Letter of May 9, 2019, requesting settlement with Michael Federico.
Yes.
That May 9, 2019 letter was one that we were just discussing, where you indicated that the drop dead date was May 15, 2019.
No, I don't think I ever said drop dead in there. I said what I said. I mean, I wrote what I wrote, but I don't see, if you want to point to me, I don't think I said drop dead.
Well, now it's May 16, 2019, and this letter gets sent by you, the board of directors for Mr. Federico's firm, correct?
Did I refer to them as the board of directors? I don't think I did. Let's see.
Okay.
No, I didn't refer to them as the board of directors. No, I didn't write that.
Okay.
I didn't write that.
You sent this letter, you said,
Yes.
and you say right up front, I had asked an attorney for your firm, Michael Federico, to settle issues in regard to his misbehavior in the Las Vegas Municipal Court in his role as alternate judge.
Yes.
You indicate that the last letter you sent was May 9th, 2019.
Yes.
And you notified him that if you, saying I, did not hear anything in response, I would notify the firm.
Yes.
And now you're notifying the firm.
Yes, I like to do what I say and say what I do more, right?
Because you're serious.
No, just that way people know I'm reliable if I follow through with what I do. That's, I'm missing if I make an appointment and I'm said I'm gonna be there at 8 o'clock and I'm not there at 8 o'clock, I call them and I let them know I'm late. That's how people know I'm dependable. When people have not heard from me for 15 minutes, they're calling to find out where I am because they know how reliable I am, what I say and what I do. I like to do what I say and say what I do. As much as it's possible.
You like to do what you say and say what you do.
Yes.
And so you're serious about what you said.
I don't know, serious is the proper word. I don't know if I could say that. The Bible tells us your reputation precedes you. So people that talk, they say Kim is reliable. I mean, if he says he's going to be at a place, he's going to be at a place, or some act of God stopped him from being there. And so,
if Mr. Blandino says he's going to do something, he's going to do it.
Yeah, unless there's some intervening event or something, act of God stops me from doing it.
And you said that.
Now, unless I find out later that it was wrong. Okay, I'm sorry.
You said that you were going to send a letter, all this information to Mr. Federico's firm if you didn't hear from him by May 15, 2019, right?
Yes, I did.
And that's what you did.
Yes.
You didn't hear from him, so you sent all the information to his firm.
Yes, yes.
And then it goes on, because Federico and his various activities can reflect either in a positive or negative on your firm, I believe it is necessary to notify you before I file with the Nevada Commission on Judicial Discipline against Federico.
Yes.
You indicate further that, right here, since I gave Federico till May 23 to settle before filing a complaint, I gave a deadline of May 15 to at least begin good faith negotiations or would notify the firm so that the firm has a heads up, in quotes, of Federico if Federico had failed to inform the firm of this situation when he might be required to do so.
Yes, I wrote that.
You go further, I attached the prior submissions I have sent to Federico for your review.
Yes.
And in fact, you did. You attached everything that you previously provided to Mr. Federico.
Yes.
That's
You
interesting.
attached the letter of April 8th, 2019, or the note. That's a yes?
Yes, I'm sorry, yes.
You attached the letter that you dropped off at his office on May 25th, 2019.
I believe so. Do you have it? Wait a minute, you're saying, repeat that question again.
You attached to this letter, or to this email.
Yeah, to my recollection, I mean, you have the original there, but to my recollection, I did.
Okay. You attached the document that you entitled Settlement Agreement and Release.
I believe I did, yes.
And you attached your follow-up letter that you sent on May 9th, 2019.
Yes, I believe they should have everything that I was referencing.
As well as all the attachments that you provided with those documents.
Yes. Would you like to know the reason why?
So you go on. That you have both the jabs of the proceedings from April 25th, 2019 and August 2018, correct?
Correct, yes.
Where you indicate here where Federico violated the judicial code as well as other duties, including his oath.
Yes, I'd obtained a copy of his oath of office.
You go further right here. I have spent much time presenting a proposed settlement that is attached to this letter and in addressing the issues directly with Federico.
I'm sorry, oh, where I lost you?
Right here, I've spent much time.
Oh, yes, okay, yeah, yes, that's, yes.
You wrote that?
Mhm.
Is that a yes?
Yes, I'm sorry, yes.
You go further, indicating something that you've said before.
Mhm.
My last two complaints to the Nevada Commission on Judicial Discipline resulted in letters of caution to 2 district court judges.
Yes,
So I do not make frivolous complaints.
yes.
Then you indicate further that what Federico did is blatantly wrong.
Yes,
Specifically referring to events that occurred in court.
yes.
You go to the next page, you write to the firm, know clearly that I'm still very much ready and willing to negotiate with Federico.
Yes,
But you indicate I will need a response within 1 week.
you skipped out a lot of stuff there, so is that what you look at?
Is that what you wrote? That you'll need a response in 1 week?
I wrote some stuff before that though, as a preface to that.
Again, you need to
Okay.
answer the question.
Yes, I wrote that.
Then you go on that if the firm has any say-so in this process of settlement, you see that?
Yes,
You wrote that?
yes,
You indicate that what you would hope is that they encourage Mr. Federico to have a sit-down with you.
yes.
You're hoping that the firm encourages him to further engage with you
Yes,
in what you've described as a settlement of your issues with them.
yes,
And then you say here,
well, I'm right, not saying.
okay, you write.
Yeah.
Please look at the attachments and know that this is serious.
Yes. So could I read the exec, you don't want to read that next thing?
Okay, again, remember, he's conducting the examination.
Yeah.
You say you really want to deter wrongful behavior in the future by Federico
Yes,
to benefit all.
yes, exactly.
You sign it and you date the letter,
Yes,
include your identifying information or contact information.
yes,
You include in this one as well a certificate of service.
yes,
Indicating that you sent this to James Olson,
yes,
Walter Cannon,
yes,
John Gormley,
yes,
Peter Angulo,
yes,
Michael Staberski,
yes,
and Mike Federico.
yes,
And that you did so on May 16, 2019.
yes,
And then we have the attachments. You have the letter that you dated May 8, 2019 that sent to Mr. Federico on May 9, 2019.
yes, yes,
The one that we've already gone through.
yes,
You have the exhibits that you attached to that letter.
yes.
You have the document that you entitled Settlement Agreement and Release,
Yes,
the one that we've already gone through.
yes,
You still didn't add anything about your intent to send this to the Nevada Commission on Judicial Discipline.
I'm sorry, what was that question?
You still didn't add anything about your intent to send your settlement agreement, should it be agreed to, assigned by Mr. Federico, to the Nevada Commission on Judicial Discipline.
I don't understand the word still. I still didn't.
Yeah, you still hadn't changed it.
Oh, you still hadn't changed that language there?
Right.
No, not to my recollection.
Yeah.
Not to my recollection, I didn't change.
I'm just going off what you testified to.
Yeah, no,
Correct.
to my recollection, I didn't change anything. I think that's what I said before.
You included as an attachment as well, the letter that you dropped off at Mr. Federico's office on April 25th, 2019. That's
At the
what-
reception area, actually, not in his office, but at the reception.
And that's what we see here.
Yes.
You included the exhibit that you attached to that document,
Right.
the customer feedback form.
Yes.
And it's accompanying several pages and the invoice that you had with that.
Can you scroll that up a little bit? Yeah, that's what's puzzling about this. They have no date on this invoice. There's no date whatsoever, but it looks to be the same as what I sent.
Okay.
What, did I reference that in the letter? Oh, I can't ask questions. I'm sorry. I forgot.
You attached that Veterans in Politics International letter
Yes.
that you attached in the previous submission to Mr. Federico.
Mhm.
And you attached the two letters that you received from the Commission on Judicial Discipline
Yes.
that you entitled Herndon Complaint and Bear Complaint.
Yes.
And then you attached the note that you wrote at Mr. Federico's office on April 8, 2019.
Yeah, in fact, a copy of the note, but that's not the note, but a copy.
Okay. You testified a bit on direct about Mr. Federico's fear that he had. You remember that?
On my direct examination, I testified.
Yeah.
You know, what's funny, I may have referenced it. I don't know exactly what context.
I quoted you, I wrote it down here.
Okay.
I said, I don't know how that could be figured.
Okay. The fear is what you're referencing.
Yeah, that's what you're referencing. You remember that?
Yeah. Yes.
You said, I have done this before. No one has ever contacted me. They just ignore me.
That's been my experience, yes.
They send these kind of letters to other judges in the past.
Yeah, numerous judges,
And they
state
have,
and federal.
okay. And so you didn't know how Mr. Federico could be in fear. You couldn't understand that, right?
Yes, based on my.
I'm glad you guys like this because it's kind of cringe listening to this guy defend himself.
In court about his fear and the steps he took because of it.
Yeah, I heard him. Yes, I heard him testify. Yes, I heard him perjure himself.
Oh, really?
Yes.
You, in fact, that's extremely offensive. You, in fact, saw him talk about the worry that this caused.
Yeah,
for
he
him
was
and his-
committing perjury. Yes.
Mr. Blandino, you've got to let him ask the question.
I'm sorry.
The worry that he had for his family, specifically his 6 kids. You heard him testify to that?
He perjured himself.
Oh, is that right?
Yes.
You saw him tear up here on the stand when he's talking about the fear to his kids, right?
Those were actor's tears. He was acting.
And you sat right there, right?
And I laughed because it was a poor performance for an actor.
You laughed.
I could not help it. When you see a laughable performance by an actor as an involuntary, my attorney definitely tells me to maintain a pose, but that's not me. Everything you see is what I am. And I couldn't help but laugh because it was just a pathetic performance. It was an act. The proof is in the darn videos. When I come into the courtroom on that day, does he call the marshal over here? I'm so afraid or anything? No, he wasn't, because he wasn't afraid. He was arrogant.
You have no empathy.
No, I have empathy when it's deserved.
You have no remorse.
When it's deserved, that's not true. I have remorse.
And you just
No, they're wrong.
are in it for yourself.
No, all for other people.
Is that right?
Yes.
Well, you testified that you did file a complaint against Mr. Federico with the Nevada Commission on Judicial Discipline, right?
Yes. Uh-huh.
And you testified that you did that, but you didn't testify when you did that, right?
I thought I was told it was irrelevant. That
No,
my recollection.
that wasn't brought up. So
You mean I testified, for clarity, you're saying I testified that I filed a complaint, but I didn't mention when I filed it?
April 8th, 2019, you had not filed a complaint against Mr. Federico.
Oh, no, right. True.
April 25th, 2019, you had not filed a complaint against Mr. Federico.
No, I wanted to settle the thing. That's clear. in the
May
letter.
2nd, 2019, you hadn't filed a complaint against Mr. Federico.
No.
May
that's
3rd, 2019, you hadn't filed a complaint against Mr. Federico.
correct. Yes.
May 15th, you hadn't filed a complaint against Mr. Federico.
Correct. Yes.
May 16th, you hadn't filed a complaint against Mr. Federico.
Correct. Yes.
And ultimately, you had some deadlines here. May 23rd, 2019, you hadn't filed a complaint against Mr. Federico.
Wait, what date was that?
May 23rd, 2019.
I was in jail,
Okay.
so it was hard to do anything from there.
In fact, it wasn't until August 28th, 2019 that you filed a complaint against Mr. Federico.
I was kept very busy. That was the earliest I could get to it.
That was months after you were arrested on this case.
Yeah, I had a tremendous amount of legal work to do in regard to this.
And you and your attorney provided me a copy of that complaint, isn't that right?
You asked for it on reciprocal discovery and we supplied it, trying to follow the rules, which I always try to do is follow the rules.
Because the complaint itself is otherwise confidential.
Well, yes, but can I elaborate on that?
No?
Okay.
So, in the complaint, you indicate that the Nevada Commission on Judicial Discipline should provide Kim the immunity Kim desperately needs.
Yes.
Throughout your document that you sent to the Nevada Commission.
That's very true, Matthew, but he still has to have that protected.
You indicated that you are seeking immunity.
Well,
in this case,
I can answer yes to that because I know I mentioned it once, but I don't know how that I did. You said repeatedly. I have to have that shown to me.
Here's the next line. Does this sound familiar? Kim needs immunity so that this evidence, recordings from around the courtroom, can be shown. Does that sound familiar?
It sounds like something I could have wrote, but if I look at it, I could definitely verify.
What about this?
I wrote it.
Kim needs prosecutorial and punishment immunity as to the claim so that Kim can present evidence.
Yes. It sounds like something.
So throughout your complaint that you sent months later, you're asking the Commission on Judicial Discipline for immunity.
Because I saw it in the rule of the law and the Constitution that you are entitled to immunity if you're a witness.
Not entitled, right? But that the Commission on Judicial Discipline does in fact have the ability and discretion to grant people.
So that's a discretionary thing. Yes, I could agree with that.
That they can grant immunity.
Yes, they have that discretion.
And so when you reached out to the Commission on Judicial Discipline regarding Mr. Federico, who was seeking immunity for yourself.
As a witness, yes.
From this prosecution, right?
I needed to see exactly how he phrased it in the complaint.
It says right there, I read it to you, prosecutorial immunity from prosecutorial punishment.
Is that published as an exhibit?
Do you want the refresher recollection if I can show you right here?
Yeah, I need to look at it.
Can I approach you?
Is it published as an exhibit though?
Okay, I'm going to show you here. This line.
Okay.
Kim needs prosecutorial and punishment immunity as to the claim so that Kim can present the evidence. That's what you wrote, right?
Yep, I wrote that. Yes.
You were familiar with the process that was available to you. Isn't that right?
As to what?
As to any issues that you took with the August 28, 2018 traffic stop that Mr. Federico sat as the judge on.
Which processes are you talking about?
Well, you were familiar with the process that you could appeal the case.
Yes.
And in fact, you did appeal the case.
Yes. There's other things that can be done as well.
And you appealed that to the district court.
Yes.
Which is a higher court than the municipal court.
Yes.
And you did that on September 14, 2018. You filed that appeal.
Well, if you're saying that's when the date was, if you want to refresh my recollection, I don't know exactly the date as to that, but it sounds plausible.
Would it refresh your recollection to look at the court docket for that case?
Sure.
May I please approach me? Thank you. I'm going to show you the docket here. Take a look at that.
Okay. Well, it's register of actions is what it states. You call it docket. It's register of actions.
Okay.
Yeah.
And this document would have the dates of all the filings.
Very familiar with the type of form.
And so the appeal from the lower court occurred on September 14, 2018. Is that right?
That was the first filed document with the court, it looks like. Yes, the first filed document. Okay.
There were many things that occurred between that date and the final disposition of the case.
Yes, there was back and forth between me as the appellant and the respondent being the city of Las Vegas.
And then ultimately in March 2019, your appeal was dismissed.
Again, if it sounds like it's a plausible date, if you want to refresh my recollection, I don't know the date.
You're familiar with State's Exhibit 29,
Okay.
right? The order granting respondent's counter motion to dismiss appeal and remand the matter to the lower court.
And then they vacated the March 14th, 2019 hearing. Right?
Yes.
Yes.
Respondent would be the city of Las Vegas.
Exactly.
So they.
Well, they say respondent / plaintiff, I'm the appellant / defendant.
Okay.
That's the way they do this.
So their motion to dismiss your appeal was granted. That was filed.
I didn't see that date, it flashed by.
Yeah, no problem.
Okay,
March
March
7th.
7th, 2019, at 1:11 PM.
That's all correct, right?
Looks to be, yes.
And then just about a month later, is when you showed up at Mr. Federico's office and wrote that person up.
I believe my recollection was I asked for an extraordinary writ from the Nevada Supreme Court.
Denied,
So
right?
Another level.
Denied.
Well,
it was denied. You
So
had,
I did do that, that's true.
that your entire appeal ended with that document. You had nothing left.
No, that's not true.
Okay.
I could have gone to the US Supreme Court on the issue. I had that option, and I thought, that's a Hail Mary, a long shot, so I forgo that option, but you can go to the US Supreme Court on that type of issue. Yes.
Okay. And so that's a Hail Mary.
Yeah.
So instead, you decided to go right to Mr. Federico.
No, not true.
That's what you did, right?
That's what I did, but that's not why I decided to do that, because of a frustrated feel to see me being fine.
Save the best with us.
I don't know, Mr. Bateman, anything? Want to allow Mr. Andino to step down?
Court's indulgence, Your Honor. Mr. Molina, you testified earlier that you, during your sort of, what you call it, your activism with the sending complaints to the commission, et cetera, that you got a letter of caution issued against Judge Herndon and against Judge Baird.
That's true.
Okay.
Yes.
And you, as proof of that, on the letter to Mr. Federico on April 25th, you attached these as exhibits. And in fact, you attached these letters as exhibits 3L to that letter. Right? Remember that?
Yes, I believe so. I believe it was 3L.
All right. And I'm showing
This won't get us to next week.
3L from Stacey's
We'll miss.
4. Now, it's the letter from the commission. Can you recall Mr. Dial being here last week to testify, correct?
Yes, yes,
And recall that he testified about the process that a complaint goes in, it's reviewed, you recall that,
yes,
and that either a dismissal is issued, a dismissal with a letter of caution, or then if it's more serious, other steps are taken, you recall that?
yes.
Okay. Now, you said that in order to know that there's a letter of caution, you have to know how to read the letter.
Yes.
You recall saying that?
And I base that on the fact that I've received so many letters over the years, you could tell from what the language states, what was done, what wasn't done, either expressed or implied.
So I'm showing here, this is your attachment at the top, that's you already testified, I believe that, right here, I'm just pointing. Herndon complaint, you testified that was your annotation?
Right, exactly. So I could identify it because the numbers there, the numerals down there, where it says 20182-216, when you send in a complaint, they send you a letter back, say, we received your complaint, and they show you that they attach that number. So you have to follow along from you. It's best to keep that letter so you can refer back to, because even I don't remember when I file a complaint necessarily. I can look at that number and say, oh, this is the complaint I put in on Judge Herndon, then Judge Herndon.
Okay.
And identify.
And so, explain to the members of the jury, how do you interpret the language of this letter to mean that a letter of caution was issued?
Okay. In that second paragraph, well, can I read that first one and the second? It's not that long.
Can you see it?
The Nevada Judicial Commission, the Nevada Judicial Discipline Commission met on March 1, 2019, and decided to dismiss the complaint you filed in the above referenced case based on a review of the relevant court records, including a hearing recording obtained by commission staff. You asserted that the judge called you an inappropriate name, failed to issue an order, made improper legal decisions and various other allegations. Now, in this case, that's another one reason I know that this is the Herndon letter, because this is the only complaint where he called me an a-hole twice in court. This actually videos all over the internet. Millions of people have seen it. Anyway, so that's the only one where I had somebody call me an inappropriate name. So that's another further identification of what this, what judge this indicates. So to go on, although the commission has dismissed your complaint, comma, it has taken what it considers to be appropriate action under the circumstances. And then, thank you for bringing the facts set forth in your complaint to the commission's attention. This, the only thing they can otherwise do, and I will testify to that with a dismissal, is either dismiss it without a letter of caution or dismiss it with a letter of caution to the judges. And in fact, this was confirmed in the reports that the commission puts out, and it shows all the different letters of caution, absent the names of the judges. But it'll say, this judge was issued a letter of caution for failure to timeliness. They say district court judge or justice of the peace or temporary judge. And they have the grounds on which it was done. So it could be on timeliness, failure to be timely in getting their work done, or administrative neglect, or in this case, for inappropriate demeanor and decorum. The code that governs that is that a judge at all times will maintain a proper decorum and dignity of the court. And I'm sure that that's what they said, hey, don't use that kind of language to a thing and don't be impatient.
Okay, and so you're saying here it says by, obviously, that says it's a dismissal or dismissal of a letter of caution, saying the language here, it has taken what it considers to be appropriate action under the circumstances.
Yeah, they have no other option.
So you said, what is different? If you get a letter that is just dismissed, is that language, it has taken what it considers to be appropriate action?
Yeah, that's not there on those other letters that I've got.
All right, I'm showing you other.
Wow, he is.
So copy's not quite as good. but you do see the same language there.
This guy's rough. He's not doing good.
Although the commission has dismissed your complaint, it has taken what it considers to be appropriate action.
Now, this is somewhat crafted
Is
differently.
that
Yes,
the
that's
same
true,
language
yes.
is there?
Yes.
Okay.
Can I read that next paragraph?
I'm not, I will go.
Okay, anything else?
Just briefly. Sir, you attached those two letters to your letter to Mr. Federico, right?
Yes.
Your testimony that you believe that those letters indicate that the Nevada Commission on Judicial Discipline issued letters of caution based upon your complaints.
Yes. No,
Okay.
it's an unavoidable conclusion.
You got results.
Yes, I did in those cases, yes.
You're proud of those results.
No, I never, pride is unbiblical,
Okay.
wrong. I was pleased, but not proud.
You're pleased with those results.
Well, I'm not as pleased as I could be, moderately pleased. If they should have really, in my view, published those decisions and given some discipline. So
Regardless,
yeah.
You attached those for Mr. Federico to see.
Yes, I did.
You attached those so that he knew that you're serious.
No, I see, you use that word serious again. The thing is that I'm not filing, and in the letter I said, I'm not filing frivolous complaints. So, you know, if I had been able to have the letters of caution, but those are not punishment, and they're confidential, then I would have attached those, obviously, to show that,
you get results.
That I have gotten results in the past, yes.
That's the witness.
Okay. Thank you very much for your testimony here today. You may step down. Mr. Bateman.
No, we have no witnesses in the bench address.
Can we take a recess, Your Honor?
Sure.
Hey, can we approach? Thanks.
Well, that's where they try to do the whole they're lawyers of fact and that any lay people can be experts in fact. That's a common one they've done. That's a common one I've heard before. You know, where I'm a lawyer in subterfuge and lies. So yes, from what I understand is a jury trial, and I still cannot find this feed that these guys are using because I don't like having all their junk on the screen. This is borderline a bit much. Like, got your logo and then like your Facebook, then your audio and video information, and yeah. Sorry, I can't work on that.
Including your fellow jurors in the day regarding the case or experiences by voice, phone, email, text, internet, or other means of communication or social media. Read, watch, or listen to any news or media.
Judge likes her big hair.
About the case. Do any research such as consulting dictionaries, using the internet, or using reference materials, making the investigation, test a theory of the case, recreating the aspect of the case, or in any other way investigate or learn about the case on your own, or form or express any opinion regarding the case until it's finally submitted to you. This time we are going to be in recess till about 1:30 in the afternoon. I apologize for that big break. The defense is done calling their witnesses. The state may call more witnesses. If they don't, when you come back, you'll be instructed on the law, and we'll go right into closing arguments. But we are pretty close to being done, and I just apologize for this big break. I also have other hearings that I had to break for at 11 o'clock. So we'll be in recess till 1:30. And remember, you'll come up here, Officer Hawks will greet you, and he'll bring you in when we're ready. I do want to extend my gratitude and my thanks to you for being here. I know we have gone a little bit further than anticipated, and I'm very grateful for your willingness to be here. Thank you, and we're in recess.
Thank you. All rise for the next meeting, please, sure.
So we're at lunch. Yeah, this is a fun break. Can I change the title? I'll work on that. I'll work on that. I'm not sure what changing the title does here. But you know, you know what? I'll just start a new one, guys. If I start a new stream, how about that? How about we do it that way? I'll be right back, guys, with a new one.